Good morning. My name is Jessica Desardin. I am a program coordinator in the Office of Community Engagement. Welcome to our 7th Community Engagement Conference, MCW Engage, showcasing community engagement in all spaces. Before we begin, I'd like to point out a few things that you will find on your table. There is a conference agenda for today. You may refer to that. There is also a QR code up on the screen. You can scan that with your smartphone and access our agenda for today. There is also a small card with a prompt, what is community engagement to you? Feel free to answer that and we will collect that sometime today. Now, I'd like to begin with a land acknowledgement statement. We wish to acknowledge the indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. Before we begin our day, I'd like to cover some housekeeping items. First, please note that this conference is being photographed and video recorded. Restrooms are located down the hallway just outside this conference room and to the left. When you checked in this morning at the registration table, outside of this main room, you should have received one parking validation ticket and a raffle ticket. If you did not receive a parking validation ticket, please go see somebody at the check-in table. At the end of the day, we will raffle books published by our morning keynote, Rayna Andrews, a TEDx speaker at the intersection of food systems, public health advocacy, urban planning, and children's literature. Please note you must be present to win. Yesterday, we kicked off our 2nd community engagement donation drive. This year, we are collecting non-perishable food items, which will be donated to Dry Hooch, a veteran-serving nonprofit organization. If you are interested in donating, you can find a QR code in our program to contribute. We thank you for your generosity. And tomorrow, we are hosting the MCW President's Community Engagement Award Ceremony at the MCW Milwaukee campus. This ceremony honors the contributions of MCW faculty, staff, students, and community partners, and their dedication to advancing the mission of community engagement at MCW. The individuals are listed in today's program. Congratulations to the 2024 recipients. Lastly, the Office of Community Engagement is preparing to launch the Engagement Hub, a new platform hosted through GivePulse for MCW faculty and staff to discover volunteer opportunities that support local community-based organizations in a meaningful and useful way. Those interested in having a profile created to post volunteer opportunities would be set up with a free account, which features to help manage and track the organization's volunteer efforts. You can learn more and request a profile for your organization by scanning the QR code in today's program. We would like to sincerely thank our planning committee for their hard work, expertise, and time investment, and of course, all of you for being here today. At this time, I would like to introduce Daniel Butchery, President and CEO of the War Memorial Center, who will welcome us to this wonderful location, followed by our Senior Associate Dean for Community Engagement, Dr. Stacy Young.
Good morning. I don't want to mess with this too much. It might fall off the handle here. Well, welcome to your War Memorial Center. Show of hands if you've been in this space before and visited the campus. Okay. And I also like when I do public discussions, I'll often ask, show of hands if you are a veteran, if you've served in the United States Military Armed Forces. Show of hands, thank you, yes. Show of hands if you are family members of a veteran. Someone all the way back to grandparents, okay. Show of hands if your family has had someone killed in action in any one of our conflicts. Show of hands if you love your freedom. And I hope I see everybody's hand up. We have our freedom because of these families right here. We have our freedom because of our young men and women who said, and they signed a blank check, and they told their United States military and our government, take me, cash that check as you deem necessary. This war memorial, your war memorial center, was built in 1957 right here along the beautiful lake shore. It was incorporated 80 years ago this year, October 14th, 1944. And if that date sounds relevant, we are at the peak of World War II. 1944, this country is seeing the highest level of killed in action. And this touches every community. 65 million people in this world die during World War II. 65 million. So what this community did, and this is a very unique memorial. There's no other memorial like this in the country. And I'm very comfortable saying that because I've been to DC. I've interacted with generals and admirals, and when they come and visit here, they say not even Washington, D.C. has a memorial like this. Why? Because we have offices in this memorial where veterans organizations operate. They wanted the culture, the art to be in and incorporated in this building because that explains and that defines freedom of expression, creativity. But when you look at this building, and by the way, at 10:15, if you're willing, I will be doing a very brief tour, high level, of the building. So I'll love to have you join me for that brief tour, and I'll talk about the symbolism that's everywhere. But this is a pedestal when you look at the original building. It's built and designed by world-renowned architect Eero Saarinen. Saarinen worked for the OSS during World War II. He does the Arch in St. Louis. He does the TWA terminal at JFK Airport, et cetera, et cetera, et cetera. This man was brilliant. He dies way too young, brain cancer. That kills him at age 51. So we're honored to have his building. But he wanted the veterans organizations. We have Paralyzed Veterans of America, USO Wisconsin, on and on and on in this building, in overwatch of the freedom of speech, in perpetual overwatch. We go to war not for death and destruction. That just unfortunately happens to be a byproduct. I'm a combat vet myself. We go there to protect what we have back here. But also an interesting part of this building, and you are supporting that by being here today. They wanted this to be a building. This meeting hall has always been a concept built into this. They wanted the community to come together, to coordinate, engage as you are doing. They wanted this to be a gathering point where we could work through some of the most difficult issues that we're dealing with in our lives, our daily lives. Resilience. We have 8,800 families in Wisconsin alone who have a loved one killed in action in World War II. This year, Memorial Day weekend, we will place 27,316 flags in Veterans Park. If you've ever seen that, we've been doing this since 2020. We've been slowly building. We finally hit the number. 27,316 flags will be placed by volunteers starting on Monday, the 20th, till Friday, the 24th. That is the number of Wisconsinites who have been killed in action since statehood, basically the Civil War, until today. Every one of those flags represents a soul, a serviceman and woman, a son, a daughter, a husband, a wife, who gave their life to defend this beautiful country. And yes, we have our issues over the years, but that's what we keep fighting to keep this country what it is, and that's what this is a symbol of. And what you're doing in here, we work very closely with the medical college. We have a strategic partnership with you. Dr. Berger, I know Mark is here right now, Mark Flowers, as part of the Mental Health Suicide Prevention Task Force. We are honored to be part of that program with you. We continue to be part of that program because it's mental health, it's suicide prevention, it's families gathering. And so this is a wonderful collaboration between all of us who have served and all of you who continue to serve your community and support what we're looking to do. So again, I so look forward to having you join me at 10:15. I know it's very tight. You've got a lot to cover today. I promise it'll be quick, 15 minutes, give you a high-level introduction to this. But I also want to extend an invitation to you at 11 a.m. on Friday, the 24th of May. In Veterans Park, we will be hosting the opening of the Field of Flags. It's a very special ceremony. And then at noon on Friday the 24th in this very space, we will be doing a premiere of our very own Discover Wisconsin episode that will run statewide that entire weekend. And it's going to be telling the history and story of this incredible building and what this community did to come together and build this. So thank you. So you're invited. And by the way, our beer garden opens that weekend too. You kind of see it's already starting to get set up down there. We work with Kettles Inn to do that. By the way, we are a private 501c3 nonprofit. Yes, this is Milwaukee County War Memorial. They own the structure. We own everything on the inside. So we raised $85,000 in that beer garden alone last year. Our goal this year is $100,000. So help us hit that mark, would you? One beer, one brat, one soda, whatever you need at a time. And by the way, once a month we do Music in the Garden in partnership with the task force. And what we do with that is we have veterans who are musicians will come in and play in the beer garden. We have resource tables out there, and it's an incredible gathering of healing, of support, of camaraderie. But we're there Tuesday through Sunday every week, so until October. So thank you. I'll be able to answer any of your questions in about an hour. Looks like, yeah, it's about 9:15 right now. And it's such an honor to have you here today. Thank you so much. Appreciate it. I don't know who's going to follow me, but I'll see you in about an hour. Thank you.
I'll let you adjust. I know not to touch tech. If you want it to keep working, don't let me touch anything. Thank you. Good morning, everyone. Good morning. My name is Stacy Young. I'm a professor in the Department of Family and Community Medicine at the Medical College of Wisconsin and the Senior Associate Dean for Community Engagement and Director of our Office of Community Engagement. We're very excited that everyone's joined us here today. A beautiful early May day. It's not raining outside yet. Hopefully everyone has enjoyed a beautiful early spring, and we're so excited to kick off the conference. Thank you so much to Dan for hosting us here at the War Memorial Center and for sharing your time later to give a wonderful tour. And thank you for everyone here for giving your time. I know everyone here is incredibly busy with jam-packed schedules. You're multitasking, probably thinking of a lot of different things, but we're glad for now we have you in this wonderful space together. I do have slides. We'll go through those. Wonderful. Thank you. The first thing I would like to do is acknowledge just an outstanding team. For those of us that have been to different meetings, conferences, events, programs, these things don't come together lightly. They take a lot of time, a lot of effort, and beyond even this program, there's so much that we do in our office, so much work that happens in community engagement, and I would be remiss if I did not acknowledge this outstanding team of individuals, our faculty, our staff, those that were greeting you when you came in, help with the registration, the planning committee, all of the individuals that support this work. I don't want to miss an opportunity to publicly say thank you, that your work is valuable, it is important, it helps advance the mission of community engagement. So thank you to everyone that is here. We all have an active role in this program, and it's just a pleasure, it's truly a pleasure to do this work alongside such a fantastic group. So thank you. The mission of our office, individuals have probably heard me share this before, but it's important to recognize what the work is that we do in community engagement at the Medical College of Wisconsin. We have 3 other missions tied to patient care, excellence in education, and research, and our 4th mission is around community engagement. And what's really exciting here is that we celebrate that community engagement is an art and a science. There's a rigor to the work that happens in community engagement, and it's also deeply relational. That's the art part of it. It's the work that almost can look easy if you see it from a distance, but those of us that are deeply embedded in doing this from day to day, in an ongoing basis, we recognize how deeply relational it is. So it's our goal to be a national leader in this area. If you were part of our conference last year, you may have recalled that I asked a rather pointed question, and I said, what is your why? What is it that brings you to this work day in and day out? Or what brings you into this work for the first time, if it's work that you are newly interested in, so to speak? If you'll indulge me for a moment, as I was preparing my comments, I was thinking about a recent experience, very recent, it was just this past weekend, in fact, where I was visiting family in the South, in the Deep South, as I've done year over year, probably throughout most of my life that I can remember. But the visits get more and more poignant every year because family gets older and older. And you start taking those visits, you hold them a lot closer because people get older, and you don't always know what time may be the last time you have a conversation with someone. So every time I have these visits, I like to visit certain members of the family, and I make a beeline to certain individuals because of just how special people are to me. And there was a moment during this visit, I was driving with my mother down Highway 90. So we're driving right along the Gulf. And some people may have met my mom. She's just this sweet, sweet little old lady. And we're at a point now where I do all of the driving, and she's in the passenger seat, very different from when we all grew up. And I was the one riding along, and she would drive. But in any event, we were driving along the highway, driving along the Gulf. Beautiful, pristine beaches. Beautiful, warm, sunny day, blue sky. And we were commenting to each other on what a wonderful day it was. And, I'm in driving mode, so I'm focused on the road in front of me. And there was a moment where she got quiet and she looked out and she said, seemingly out of nowhere, but it had probably been on her mind, she looked over towards the beach, towards the water, and she said, "We couldn't go there. We were not allowed to go there. We couldn't picnic there. We couldn't stop." And she didn't have to give any other information. I knew exactly what she meant. I knew the context that she meant. She didn't have to say who we was. I knew. She said we couldn't go to the public library. We couldn't go to the same schools. We couldn't even go to the university. And I just listened, and give me a little grace here as I reflect on it, because this is the first time I'm saying this out loud. Didn't think it would kind of catch me the way it did. But just hearing that from her, and again, not for the first time, but hearing her say, we could not. We couldn't go to those spaces. Public spaces, public, meaning they're meant for everyone, but she said we couldn't do that. And then I took a moment to look over at her briefly, because I'm driving kind of quickly, and I could see a moment in her face where she just pinched a little bit. And I could see the embodiment of that pain in those moments. And I thought to myself, that's what lived experience looks like. And it's decades later. This is, it's reflecting on a time back in the 50s. But that matters not, because the history was present. This is not, where you can say that was a long, long time ago. The history was sitting right next to me in the car 2 days ago. And to hear that and to see that, the embodiment of lived experience, made me think about what the collective we is. And it reminded me again that the work that we do in community, for a lot of folks, is deeply embedded in the lived experience. So when we're working with partners, whoever that is, or even ourselves, recognizing that when people bring their lived experience to the table, that's knowledge, that matters, and people carry it. Sometimes it's carried like a bruise. If you've ever had a bruise and someone pokes on it, that hurts, right? That's a tender spot. And so when we think about the work that we do in community engagement, that it's relational, when we reflect on knowing that there are some folks in the community that have not had the greatest of experiences for whatever reason, those spots are still a little bit tender, and we have to be careful in that work. We don't go up and just sort of poke at it or say, well, why are you still bringing that up? Well, sometimes that bruise is still there. It doesn't always hinder work moving forward. My, family members are live and vibrant and, moving ahead in their lives, but it doesn't leave behind the things that people have had to deal with and to move forward. So the other thing that occurred to me in this visit, as I was talking with family members, is how wonderful it is when people, if any of you have been in this space and you get a lot of family together and people start talking and reminiscing, and it's just nice. I mean, I'm a grown woman now, but I can remember being a 9-year-old child and listening to family members talking. And, of course, when you're a child, then you kind of know you're not supposed to say a lot during, in grown folks' business. So, you just kind of sit and listen. But as a grown person, now I think I can participate more in these conversations. But the wonderful thing was, during some of these conversations, I didn't want to say a lot. I wanted to sit and listen to these individuals that have decades of wisdom and life experience far beyond anything that I even have now as a grown individual. And listening to them talk about the power of we. They're not trying to do this because they think I'm going to use it in a talk or anything like that. But they were talking, one of the older individuals in the family said, we did what we needed to do to take care of each other. And they kept using the word we. No one said, this is what I did. This is what I did for myself or what I did for my whatever. They kept saying we. And the power of we was important for survival. Because they knew if we didn't do these things together, then people would literally suffer. Not everyone grew up with a whole lot in that area, but people knew that they had to come together to feed each other, to support each other, to protect each other. And that was the collective power of community. So thank you for indulging me as I comment on that, because when I think of my why, those are some of the things that remind me of why. That when we're tackling some of these really tough health issues, any tough issue in our community, it's not something that any of us just look at and say, well, that's too bad for any of those folks over there. It's more so, what do we do to help improve any particular situation? And it doesn't always come with degrees or titles or even the organization that we belong to. It's part of being a collective in a society that cares about, or hopefully cares about each other enough to roll up our sleeves and to do some of this tough work. We asked everyone here, I know I kind of went a moment a bit off script, but we asked, what do you think about with community engagement? And I'll pull a couple of these because I was interested to hear what people say. Community engagement is the act of putting one's hands and heart in the community to invoke necessary change. Listening to the community followed by action. The shared responsibility of each member within shared community. It is cooperation and collaboration, exploration and results-based. It's participation, which allows you to engage with others and build trusting relationships. Communication will be the key to good engagement. It's having a connection with people living in the community that you serve. Understanding the hopes, dreams, and experiences of the people in your community and working together to progress. I'm sorry that I'm not able to read all of these. We're keeping all of these, and we'll share those because hearing what you all think about community engagement is just so powerful and important. So thank you for taking the time to do that. We can also think about community engagement in, dare I say, a little bit more of a academic sense. It's also about collaboration between institutions of perhaps higher ed and other organizations coming together for benefit of, there's reciprocity, right, and mutual benefit. That's what we hope for in community engagement. I'll go through a couple of these slides a little bit more swiftly to keep us on time. But I wanted to note that the work of the Medical College of Wisconsin in community engagement is quite broad and far-reaching. We have literally hundreds, over 1,000 different community partners locally, nationally, internationally. And the work that we do is uplifted by our faculty and staff. And it also supports the missions that we have, the mission to institutionalize our work, develop innovative programs, leveraging the opportunities that we have. This is a great opportunity in this room, all of the collective power of the folks in this room to advance the work. So it's just really important that we continue to note the ways in which we do this at MCW. One of the things we're excited about is our new platform to support volunteerism. We found in conversations with a lot of individuals that people are interested in community engagement, but don't always necessarily know where do you start? Where's an entry point, so to speak? Or how do I continue to nurture what I'm already excited about? So we are developing this platform called the Engagement Hub, and we will populate it such that there will be different organizations that have opportunities available for people to step into, yourselves, your students, your colleagues, get a group together. So we're really excited about that. So for individuals here, if you've got an organization and you're looking maybe for opportunities for individuals to volunteer, please do reach out to us and let us know. But we're really hoping that this can be another way that we can provide service and outreach as part of the continuum of community engagement. We're very excited about Thrive on King, which is now official. If you've been on this journey with us, you know it's been 6 years, I think, in the making at least. But the Thrive on King building, which is on MLK Drive, just a couple blocks south of North Avenue, we are now moving into that space, a number of us from MCW, including the Office of Community Engagement. It's a great opportunity for us to work collaboratively, those of us that are really focused around community engagement, addressing health disparities, and advancing health equity. We will be co-located in this space alongside the Greater Milwaukee Foundation and our partners on the first floor, including Maleka Early Learning Center, JobsWork, MKE, and the Versity Blood Center. So we're interested in future, yes, thank you. That deserves a round of applause. Thank you for that. We're really excited. So I just want to quickly set the stage. What we have planned for today. And this, you notice this is our 7th annual conference, so year over year we keep wanting to refine, focus the work, and we keep building upon the great feedback that we've gotten from individuals here. If you've been coming to our conferences, we've been learning the things that people want to have in such a convening. We wanted to have a nice balance of time that you're getting information from each other. We've got excellent keynote presentations that will start shortly, and then this afternoon. So we wanted opportunities for people to learn, kind of absorb information, but also to have a lot of interaction, time for you to learn from each other. We've got breakout sessions that allow for individuals that might be a little bit newer to community engagement, those of us that are a little bit further along in our lives and careers with this work, or maybe you're at a point where you're transitioning in your in what you're doing, and you'd like to think about ways that you can transfer knowledge to others. You're wanting to make sure that the next generation of community engagement is in good hands. So we've kind of got the breadth, if you will, across the different breakout sessions that we have. We'll have panel presentation this afternoon, so hearing from individuals and their own experience, back to the comment around lived experience. And finally, we have a World Cafe this afternoon. If you've not been involved in a World Cafe, they're very dynamic. We get to dig into a number of different topics, but at a quicker pace, but still very productive, and allows for us to cover a lot of different topics. So we are very excited. I keep saying that, but it's because we're very excited. There's a lot that we hope you gain today. First is perspective. Learning about perhaps learning something different. We bring our own lens, our own background, our own experience, but maybe it's an opportunity also to learn from each other. Thank you for the grace in what I shared earlier today. It was my own perspective, or what I was sharing somebody else's perspective and what they had experienced in their life, but why that matters for what community is so important. We hope it's an opportunity for you to focus in the midst of a whole lot of things that are probably going on, that we have an opportunity to come together and really focus on a number of different topics and grapple perhaps with some really tough issues as well, but we can do that together. Growing awareness. I don't minimize the power of awareness. I don't make assumptions about what people know or don't know. So I'm here to learn alongside everyone else, but becoming aware of some of the issues, some of the things that the rest of us may be dealing with in our organizations, in our work, with our learners, or maybe you are a student and you're here. Any of those things, all of those things matter. So having awareness and a renewed energy for collaboration. A lot of the work that we do is not always easy, right? And sometimes we need a little bit more of that boost, more of that time to encourage each other. I saw a lot of that here. I saw a lot of people greeting each other. Sometimes I think I saw a few reunions or people that hadn't seen each other in person in some time. And it's nice to see that. It's nice to see that people want to keep encouraging each other and lifting each other up. So renewed energy for collaboration, and finally some space to breathe. I mean that in the literal sense and in the figurative sense, the opportunity to come together in the spirit of collaboration, in the spirit of community. So please do find each other throughout the day. Share your additional thoughts around community engagement. If you've not already done so, please find any member of the team to share those with us. If you have an intention throughout the day that you're reflecting on or that you want to step deeper into, please share that on the papers there on the back wall. And anything that you're thinking of throughout the day, anything that's pushing on you or anything that you're reflecting on, please do share that with us and with each other. We're just so thankful that you're here. And with that, I am going to now turn the podium over to Dr. David Nelson, Professor in Family and Community Medicine, and he will introduce our keynote speaker this morning.
Thank you, Dr. Young, for setting the context for today's conference, and for me personally, for sharing a personal example between you and your mother. At this time, I have the honor of introducing our keynote speaker, Rayna Andrews. Ms. Andrews is a multifaceted leader and TEDx speaker. Rayna's dedication to sovereign food systems spans continents, with a focus on promoting bioagricultural diversity, solar energy integration, and agricultural independence in developing nations. Her commitment to nutrition security as a public health imperative is evident in her initiatives promoting food is medicine concepts and sustainable short food systems. Rayna serves as the CEO of the Healthy Food Movement, a wellness organization dedicated to enhancing food literacy and security in marginalized communities. Additionally, she serves as the executive director of advancement and engagement at Food for Health, spearheading innovative medically tailored meal programs aimed at combating diet-related diseases and fostering self-reliance. Beyond her professional endeavors, Rayna is an accomplished children's book author, weaving tales of adventure and empowerment. Her Alex McGreen series instills values of healthy eating and community activism in young readers. Residing in Milwaukee with her young son, Rayna finds fulfillment in various pursuits, such as hosting a monthly web series, Coffee Conversations with Scientists, in partnership with the Medical College of Wisconsin and advancing a Healthier Wisconsin Endowment, highlighting Wisconsin's leading medical advancements. She is an avid traveler, a passionate painter, and an active volunteer for global health initiatives such as freshwater access and polio eradication. Her unwavering belief in equitable nutrition as a fundamental human right fuels her vision for a world free of diet-related diseases where everyone has access to nourishment. Through her diverse pursuits, Rayna strives to create positive change and inspire others to join her in building a healthier, more equitable future. At the end of today's Rayna's comments, we will have 15 minutes for a moderated question and answer. Please use the notepads on your table to write down your questions, and our staff will collect them at the end of Rayna's remarks. Rayna, thank you for being our keynote speaker this morning.
Would you like to use a handheld or the podium mic?
I'll use this. Thank you. Good morning. Let's test this thing out just a little bit. Where's my convertible? Here it is. All right. So, wow. Thank you, Dr. Nelson. You know, I've been in this food space for over 16 years, and I've known Dr. Nelson for the last 10. And so, needless to say, he is a dear friend. And I want to extend, before I go into my remarks, a thank you to the Medical College of Wisconsin for inviting me to be this morning's keynote speaker. I don't take it for granted that I'm sitting in the room with champions, giants, real practitioners in the space of public health that know what deep community engagement is. And so today, as I've prepared my remarks, I just want to invite you on a journey. I want to invite you on a journey through the corridors of our collective consciousness, into the heart of a profound societal issue that's near and dear to my heart, nutrition security. I'll share stories that underscore the complexity and magnitude of the issue and its profound impact on our community, specifically public health, and what we can do about it, not only across America, but right here in our backyard of Wisconsin. Today, I invite you to delve deeper into the nexus between food insecurity, nutrition, race, and public health, as we explore how we can transform this crisis into an opportunity for collective action and social change. So, as many of you may or may not be familiar with what I mean by hunger, I'm gonna catch you all up. Are you all familiar with food insecurity? This is what we do. And so, for those of you who are not, in a modern world of plenty, when you think about Wisconsinites, it's almost unthinkable that 570,000 Wisconsinites don't know where their next meal is going to come from. That's 10% of our population. And just to illustrate this further, we know about the Green Bay Packers, we know about Lambeau Field. If we filled Lambeau Field to the brim, multiply that by 10, that's what hunger looks like in Wisconsin. You know, I talk about hunger, but the US government does not acknowledge hunger because hunger is at the individual level. It's a bodily symptom, and they refer to it as food insecurity, which is the affordability, availability, accessibility in any given period of time. And so today I want to talk about food insecurity from the national perspective, the macro, and bring it down to the micro, the statewide level. With 333 million Americans, 12% of that population is food insecure, roughly 41 million individuals. What's shocking, though, is that 50% of the population is one paycheck or one sick day away of being at the poverty line. And if that doesn't ring the alarms in a sense of urgency, I don't know what does. You know, food insecurity isn't just about empty stomachs. It's a multifaceted problem with far-reaching consequences for health outcomes. You know, in 2016, when I was working for one of Wisconsin's largest food banks, I did a TEDx. And the title of my talk was Food Insecurity is a Public Health Concern. And there were 3 things that still reign true today, even after 8 years of giving that talk. One is this narrative, and Dr. Young, I feel like you read my notes, is the them versus us, or them versus we. This narrative that somehow people who are insecure, housing insecure, did something to get there. Like, why can't they just pick themselves up by their bootstraps, as if it's an individual lived experience and not looking at it as a systemic issue? Well, what I'd like to challenge, or for you to consider, is that food insecurity is a symptom of household instability. Consider household instability being like a wheel on a car, right? And you have different spokes. I call wheel, tire, wheel on a car, right? And in order for a house to be stabilized, you need food, health, housing, and employment, and they have to be working in concert. And let's say if one of these things were out, like food or housing, you would be unstable. You'd be facing household instability. And so what happens if you have a flat tire? It's pretty hard for you to move. And so that's why I say you can't talk about them versus us. Why can't they just pick themselves up by their bootstraps? Because it's likely they don't have boots in the first place. You know, in my TEDx, I talked about the scenario of Margot, Jose, Maria, and Gary, and I talked about them being very different people and how we have to shift from statistics to being in community and understanding the lived experience of our neighbors. Where Maria being a single mother of 2, and Jose being a migrant who works 3 jobs trying to make ends meet, and Maria, who is a senior on a fixed income, and Gary, who's a father and a husband of 2 that just got laid off. What all of them have in common is that they're having to make tough decisions between putting food on the table and keeping a roof over their head. In this, it's imperative that we realize that in the complexity of household stability, that us as practitioners, we can't just focus on food. We can't just focus on housing in a silo. We just can't focus on education or employment. We have to work in concert with one another. And once you realize the complexity of household instability, and we start working in concert where we each put our puzzle piece together, we can create this whole anti-poverty strategy that eliminates those barriers to accessing necessary resources. And when we work in concert, we're not just monolithic thinking, I solve the issue of hunger, I solve the issue of housing, because if you solve the issue of hunger without solving housing, unemployment, healthcare, education, you repeat the vicious cycle. I mention this because the United States has an audacious goal. It's a bold goal by 2030 to solve hunger. In poverty, they have 17 global goals. With this collective impact, we can go from feeding America to nourishing America. By 2030, they set this back in 2015. I don't think it's impossible for us to reach it, but we have to have a sense of urgency and really put in our mindsets that if we don't act now, and if we don't come together and operate in concert, that people are dying. You may be thinking, Rayna, you're being dramatic. Wait and see. So the United States has 2030 goals. Ending hunger is not impossible, but it requires 2 things. One, that we acknowledge the role that racial inequality in our history, those seeds that were planted back in 1865, 1934, 1948 to present day are still wreaking havoc on societal norms. Second, we have to work together to tackle these inequalities in the spaces of education, workforce, and our communities. And so what is the scope? As I mentioned before, there are 41 million Americans facing hunger. That's 12% of the American population, where nearly 41% live below the poverty line. In Wisconsin, when you talk about the poverty line, for a single person, let's say Maria, living on a fixed income, Maria makes less than $15,000 a year. When you think about Gary, a father of 2, a family of 4, makes less than $30,000. And so when you think about this, there are members of many groups who are more vulnerable to falling below the poverty line. Like veterans, there are 1.4 million veterans in America living at the poverty line. Disabled persons are 2 times more likely to be at the poverty line. Women and children are 3 times, and seniors are 4 times. However, within each vulnerable group, when you consider race, particularly African American, Native American, Latino, they fare far worse. Where veterans of color are 2 times more likely to be at the poverty line. Disabled, 3, women and children, 2, and seniors, 4 times. You continue to multiply it. And so the question is, why do people of color have higher rates of hunger and poverty? Let's do a couple shares, right? This is call and response, okay? I'm not a talking head. So why do you think that could be? Anyone? Anyone? Systemic racism perpetuates this. Any other thoughts? Grocery store chains don't want to be in poor neighborhoods. Redlining, mapping, segregation. The critical race theory we're not supposed to teach anyone. We can all clap for her. What I'm going to say is uncomfortable and it's inconvenient, right? But the reason for this, truly, all of what you've said is valid, and it all contributes to the racial wealth gap in America, where the common denominator among African Americans, Latinos, and Native Americans is that these communities have experienced racial discrimination throughout U.S. history, resulting in higher rates of poverty and hunger. And race, in talking about it, is important to ending hunger and poverty. We all bring, as Dr. Young said, our own lived experience to this. And being in communication, being in connection, and being able to talk about race in these very important dialogues is essential. Some people have had conversations about race, and it's like, ooh, I don't like that. I didn't like the way they responded to me. Some people had positive conversations, and some people have had no conversations. But in just a second, I'm going to walk through why it's so critical that we understand the historical context and take it from the lived individual perspective and bring it to the systems level to help us understand the works that were law, the impact that it has today. And so I want to talk about two things. One is workforce and another is our neighborhoods and housing. They're just two policies that I want to really comb through to illustrate the impact of this work. And I have some on your table, and I have 13 other policies at my table over here if you visit me later. But what I want to share here is that the Fair Labor Act of 1938 was the first minimum wage legislation. It happened during the Great Depression in the 1930s and enabled millions of Americans to put food on their table and to finally get a jump start at least joining the middle class. Racial segregation workplace during the Great Depression really limited African Americans in the space of tip-based jobs. And unfortunately, during the Fair Labor Act of 1938, African Americans predominantly and people of color were disqualified from getting a stable minimum wage. And so unfortunately, this policy is playing out today and continues. And I'm not sure if you're familiar with the Social Security Act of 1935, which completely compounded that. And so when I give the examples of Jose and Maria and Margot and Gary, what happened in the 1930s, what happened in 1865, continue to compound and show up today. As a matter of fact, today African Americans are still disproportionately in temp-based jobs and being legally paid $2.33 an hour. The next point that I want to make is that there's hope here, and I know there are a number of organizations, probably many of you around the room, who are working on this. So how do we combat this space of workforce and not being able to bring home a living wage? One is actually pay people a living wage, right? I may be talking fighting words here, but it's really as simple as that. Paying people a livable wage with good benefits, health insurance, retirement savings plans, paid time off, and child care assistance. Aggressively recruit and train workers of color for higher paid positions in industries. I often hear, well, there aren't any black people. There aren't any Latinos. I can't find the Native Americans, right? And identifying all positions where workers of color experience a racial gap and help to close that gap. And so some of you around the room may be like, you think they're going to do all that? If we're going to close the gap, it's necessary. Regarding housing in our neighborhoods, owning a home is in a neighborhood filled with opportunities and resources is a cornerstone of the American dream. Some Americans, however, are far less likely to achieve this dream. And unfortunately, it's due to practices of the Federal Housing Administration, which is a federal agency created in the 1930s to help struggling Americans buy a home and finally join the middle class. Are you all familiar with this? How many of you are familiar with redlining? All of us. Well, the beauty of the National Housing Act is that it provided opportunity for some. The tragedy is that it didn't provide opportunity for all. This law guaranteed federally backed loans to whites, legally refused loans to blacks and anyone else who chose to live in or near black neighborhoods. The Federal Housing Administration offered low-interest mortgage rates, but these loans were not available to everyone. While most whites were guaranteed loans, African Americans, along with anyone else who chose to live in African American neighborhoods, were legally refused loans. The practice is redlining. You know, people of color are more likely than others to live in areas concentrated in poverty with limited opportunities. How many of you are from Milwaukee or have lived here at least 2 years? When I first moved here, I'm originally from Houston, Texas, by way of New Orleans. That's our connection. What I noticed is the hyper-segregation. And I noticed that, wow, there are the Latinos that live here, the African Americans live here, whites live there, Asians, Native Americans, they're sprinkled in. And I couldn't understand that. Where when I moved to the east side, I had grocery stores, there were hospitals, there were shopping centers, they had great restaurants. But on the north side, you had a bunch of fast food chains. And whenever I went to a grocery store, you're lucky to get produce that wasn't out of date. And so the reason why I mention this is that there are solutions that are available. And in order to truly solve this problem, we have to focus on our most vulnerable. And when we help lower income people of color purchase and restore homes, which will increase property value in their neighborhoods, think of Habitat for Humanity and Axe Housing. Woo! Like, these are organizations that are doing the good work to help not only build the capacity, get buy-in and ownership from the individuals, but put them on a trajectory to transfer generational wealth, which is one tool to close the wealth gap. Investing in lower income communities by ensuring access to amenities and services that make neighborhoods more livable, such as grocery stores and hospitals. I think the fight in the neighborhood of Bronzeville to bring that Pete's Farmers Market is a good example of this. And finally, prioritizing initiatives with poverty rates between 40% and higher when you focus on where do we engage communities. Why is Thrive on King located in the 53212 zip code? Is because on one side of the street has a 10-year life expectancy gap than the other side of the street. And so I really want to transition us to the fact that I've only highlighted 2 federal policies, but on your table, I listed 8. And at my desk, if you're interested, there are more than 13 that go up to even the present day with the voter acts. And my objective in sharing this with you is to highlight, due to a lack of access to capital, land, and lost opportunities, that there's a 13-to-1 racial wealth gap in America. For every $13 that a white person makes, or earns, or retains, a black person only retains 1. And I'm not up here to be a Debbie Downer. There is hope in what I'm about to share and how I conclude. But I want you all to know that talking about race can be uncomfortable, but just to share that's essential. And if we're able to look at it from an individual norm and experience and bring it to a systems level and acknowledge the past that was and is still perpetuating today, I just offer that as a lens for consideration how we build our work going forward. And so how this shows up in my work is that I really focus on the lens of health equity. In the pursuit of shifting the narrative from feeding America to nurturing America, I play in the space of nutrition security. And so nutrition security is very different from food insecurity because it focuses on the health and well-being of the individual. It looks at the societal, it looks at the history, it looks at the tradition, and ensuring equitable access, affordability of foods and beverages that promote well-being. And so again, the reason why we focus on this is that it's imperatively critical. And there's a sense of urgency because 60% of Americans have at least one chronic disease. That's 60. So that's if I went 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. That's more than half of this room who has some type of diet-related disease. I'm talking diabetes, hypertension, cardiovascular disease. 85% of U.S. healthcare expenditures are spent on chronic disease. 87% of employers believe the cost of providing health benefits will become unsustainable in the next 5 to 10 years. And even worse, 74% of relative increase in diabetes prevalence in those at the poverty line versus those with lower income earners. So to further highlight this problem is that particularly here at the micro level across the state, we are sick as a population. When you think about the #1 killer in Wisconsin, some would think it's the opioid epidemic, right? Some would think it was gun violence. But to think that the #1 killer is diet-related disease is astonishing, where 35% of deaths are preventable diseases in Wisconsin. And it's costing us, where 65% of Wisconsinites are either diabetic, pre-diabetic, or yet to be diagnosed, and our social safety nets, such as Badger Care or Medicaid, spend $1.15 billion a year on diet-related disease treatment. If you don't think this touches you, it touches your tax dollars. It touches your pocketbooks. In the next 5 to 10 years, if employers say it's unachievable or unsustainable to provide health benefits, if you weren't interested, I hope you're interested now. And so I have the privilege of working for an organization that's a local nonprofit social enterprise called Food for Health, where I serve as the executive director of advancement engagement, where I get to be in community, design strategic partnerships, and apply this health equity lens. Food for Health focuses on vulnerable populations. I'm talking populations up to 200% of the federal poverty limit, living with diabetes, hypertension, cardiovascular disease, high-risk pregnancy. And when we were in the research and development phases of designing this organization and this intervention, which is the birthing of the Endowment Company, which went from pharma being 160 years in treatment to now focusing upstream on prevention through nutrition, what we realized is that there are 6 barriers to the diet and lifestyle challenge. Many food programs focus on it being free and you being able to access it. But truly to transform health, people have to be able to save time. They have to have some literacy. It has to be accessible, save them costs. It has to taste good, and they have to have support. And in our program, we've been able to solve for all 6 indicators. And so how this works is that at the core, we provide medically tailored meals, 10 fresh, never frozen, delicious in nutrition, where our registered dietitian nutritionists and our culinary team come together to create nutrition guidelines specific for people with diabetes, hypertension, cardiovascular disease, high-risk pregnancy, to take the guessing out of what do I need to eat to live. Then we wrap that around with one-on-one weekly health coaching, so it's high touch and integrated, where we have master degree level health coaches and our registered dietitian nutritionists who work directly with program participants. We provide health risk assessments and SDOH screening to identify what are some of the barriers to program participants successfully completing our program, to ensure that we're addressing that either by doing a closed loop referral through Unite Us or referring them to a very small loop of organizations that we've worked with who do well with housing, employment, childcare, education, etc. We provide biometric screenings, which serve as a health report card. We provide education. Literacy is a really big part of that. And I say this because what's important is that it's individual care that's focused on health outcomes. In our program participants, if someone in the back can help me advance this, we focus on outcomes. So in our program, on the next slide, it focuses on a small pilot that we did. Within a 6-month period, we were able to see that predominantly 86 seniors were able to transform their health. We work with individuals with type 2 diabetes with A1Cs of like 14. Within a 6-month period, we were able to help them manage it to A1Cs of 8. If you're obese, if you have diabetes, it's likely that you have the comorbidity of hypertension. We were able to help them reduce their hypertension. And within 6 months, out of eating whole, natural, scratch-made food, the average weight loss was 25 pounds. This is phenomenal. This is what happens through collective impact. At Food for Health, we realize that we've set an audacious goal because what we're up against with 35% of the population dying of diet-related disease, that we've got to work in concert. And so what we focus on is, in the next 5 years, having an audacious goal of serving 50,000 individuals, helping them address the issue of diet-related disease. And that only works in concert and in partnership with folks in healthcare and folks in workforce development and housing and education, because you have the grassroots relationships that we don't have, but we have the intervention that the market has been missing. And so what I'll say in the very end is that as we focus on feeding the line, we've also focused on shorting the line. We are a USDA, FDA certified food manufacturing facility, the only one in the state of Wisconsin focused on medically tailored meals. We're the only members of the National Food is Medicine Coalition, which is a collective of practitioners who have been around for over 30 years providing medically tailored meals, starting off with the wasting syndrome of the HIV epidemic back in the 80s. Now we're partnered with the Harvard Center for Health Law and Policy to do longitudinal studies to provide evidence that food truly is medicine. The Tufts University New Food is Medicine Institute is helping us with this and helping our partners from across the country. As we've been focused on feeding the line, this is all a part of our strategy to shorten the line. What we've been able to see not only in our program, but in similar programs across the country is better health outcomes, lower cost of care, and improved patient satisfaction. What I also want to shout out is California, Massachusetts, New York, North Carolina, and I'm proud to say next, Wisconsin, are truly moving the needle in health equity by working in concert with one another to get in lieu of services and 1115 waivers to allow, instead of writing prescription drugs, to write food as medicine, fresh fruits and veggies, produce boxes, medically tailored meals. Imagine that. And so with this, I hope you take away that if you're interested in the racial wealth gap learning simulation, invite me into your organization to lead that organization to create a safe place on how we talk about race and how the policies of the past are impacting us today and what we can do about it. I want you to bring this work to your collective spaces, from your home life to your workspace, to your congregations, if you have the space to advocate for policy. I just want to drop my top 5 books that I absolutely love. Black Food Matters, Toxic Charity, The China Study, Freedom Farmers, and Food Politics. And in closing, I want to leave you with this. I want us to remember that food insecurity is not just a problem, but it's an opportunity. It's an opportunity for us to redefine who we are as a society and what we stand for. And by recognizing the inherent dignity and worth of every individual, regardless of their socioeconomic status, we can build a world where access to nutritious food is not a privilege, but a fundamental human right. So let us stand together, united in our commitment to nourish our communities, heal our planet, and build a future where no one has to go to bed hungry. Thank you.
Wow. Wow. Well, I just have filled up a card, and I hope you will too with questions. So Dr. Simmons is going to be walking around. If you have a question, you can put it on this card, and we'll ask Rayna questions for the next 15 minutes. And if we go a little bit over, we'll make it work within our schedule. But Rayna, thank you for that powerful talk today. Truly inspiring. You know, and I was wondering if you can answer my first question is, you know, if we stabilize nutrition security, how might that stabilize the other social influences that you were talking about?
So I want to say, by stabilizing nutrition security, it allows for individuals to have the opportunity for greater health. And when you focus on health, you can then stabilize them to economics, where they can drive revenue for their home. When they can drive revenue for their home, they can then stabilize themselves in their house. But in stabilizing nutrition security, the point that I'm making is that you can't just focus on nutrition as a monolithic solution. You have to work in concert, that the other household stabilizers are imperative. But once you got the nutrition part figured out, you can then move on to focusing on those other things. But you have to look at it in concert, where food just can't be about food and housing just can't be about housing. We have to move out of our silos and work collectively.
Well, Chris is getting questions. I'll ask another question. You know, you mentioned the idea of compounding issues, and you were talking about if we don't do this, right? We are in the affirmative, and I know you are too. Can you talk about what it means to compound issues in the positive, say, for the next 25 years around nutrition security?
So in my presentation, I talked about how there's some vulnerable populations, such as veterans, disabled, seniors, single women with children. And there's a layered of compound effect that if you're a person of color, due to all of the policies that I listed, that you're 2 times, 4 times, 3 times more vulnerable to be at the poverty limit. If we do act with a sense of urgency, work collectively on these issues in concert, people don't like the word poverty. But if we work on an anti-poverty strategy where we each put our puzzle piece together, we can create these dynamic plans where we're working in concert to solve these issues. And when we're working in concert, you'll see cross collaborations of organizations like Food for Health, who's focused on nutrition security, working with the Medical College of Wisconsin as a principal investigator, and working with Habitat for Humanity or Axe Housing. So if you stabilize housing, you provide nutrition, you grow the muscle on how to eat healthy, then you build their education and their skill set to get a working job, you fundamentally lift them out of poverty. So that's the affirmative of what it looks like when we work in concert.
The next question is something near and dear to all of us, and I was wondering if you could speak into what it means to provide good food for children. And then also, if you would say, when we talk about working in concert, if you could build in some of the literacy that you've been working on over the last decade or so.
You know, thank you for that prompt. So I do have my children's books here, the Alex McGreen series, and I started this series while working in food banking. And oftentimes when we go to health fairs, we'd have like cucumbers and mangoes and apples and lettuce and greens. And the kids weren't interested, neither were the adults. What we realized is that sometimes, well, what I didn't realize then, but I realize now, that oftentimes we eat for tradition. We go after the familiar foods. And so at one of the farmers markets or one of the fairs, I remember bringing a blender and started making Alex McGreen smoothies before Alex McGreen was a dream. And so the importance of nutrition in our children is that it helps with developing minds. They develop a muscle, they develop a habit that leads throughout their life. When we focus on prevention through nutrition, we don't have to focus on rehabilitating adults. And so I created the series, Alex McGreen, The Tale of the Mysterious Kale, to get not only children, but adults rerouted to the source of our food, so that now pregnant mommies understand the benefit of eating healthy and the impact that it has on baby in utero. So when baby is born, they're familiar with kale and coconut and mangoes and yummy pineapples. And it's more gamified and it's fun rather than we don't eat that. Yeah.
I love that. Thank you. I think this is another important question, and we'd love to hear your thoughts on it. What role do or could Milwaukee's community gardens and people who are in that space do to improve the health in our community?
So I think community gardens are beautiful, especially when they're beautiful. But we know community gardens cannot be attractive, right? But I think the beauty of community gardens is the collective work of people getting rerouted to soil. You know, in my book, Alex McGreen, The Tale of Mysterious Kale, Alex, the main character, has a wonderful relationship with her grandfather, who had a history of being a sharecropper. And when there was almost like a famine-like in their small town, his family grew so much food that they were able to feed the rest of the people in their neighborhood. That is a lost art today. The children of today consider growing food as being too laborious. It's being slave work. It's being untouchable. It's something that we don't do today. I think the beauty of community gardens is that it's a tool to bring community together. But I think what could be added to community gardens is literacy Literacy not only in the history of how we got here and the beauty of what's being grown and how to use it, but also introducing them on how the foods that we grow heal our body, and how coconut is great for the development of young minds, and how dark leafy vegetables like kale and greens is great for vitamin C in our cardiovascular system, and how tomatoes are grown. And I feel like this literacy is a missing part of the art of living. And I think community gardens have the capacity and very well could do that and be that bridge for community.
I love that example. And Rayna, I have a former student who's a pediatrician, and he's just finishing residency. And he said to me, he said, you know, I'm a gardener who happens to be a physician also. And so when you talk about partnership, right, how can something like nutrition literacy really support partnerships between food and health and food and stability of housing and frankly, stability of community?
Absolutely. So it's exciting that you have a physician that's also a farmer because they're probably closely connected to nutrition. How many of you have been to the doctor's office and you get on the scale and they're like, boy, well, you can fix this if you lose a little weight? I've been there, I've done that. Unfortunately, the provider-insurer relationship doesn't allow for physicians to go into nutrition and to walk you through what you need to eat to lose weight, what you need to eat to live. And so what I would say is the role of nutrition is partnering with organizations like Food for Health that can be an extension of the care management that's already offered. And that's a great plug. So Food for Health is located at 2007 North Dr. Martin Luther King Drive. We're right down the street from the new Thrive on King. And bi-monthly, we provide free, regardless of socioeconomic status. David and his team were there, cooking classes, fitness classes, and lifestyle. Intergenerational fitness classes where we do mindfulness, balance, yoga. Hands-on cooking classes where you get to taste a sample of variety, you learn the recipes and you take the recipes home. And our lifestyle, like it's one thing to eat, it's one thing to get some movement, but how much sleep should I be getting? How do I manage stress? How much water should I be consuming for my body type? All that kind of literacy is imperative. And we teach that and we bring people to a place of self-reliance.
I know more about eggs than I ever thought I could know. So it was really a fun class, and they're happening all the time. This is the last question I want to pose to you, and I want to set it this way. I really appreciate at the beginning you talked about working in concert, and I love that phrase because it means that you're harmonizing, whether it be in singing or playing instruments. And the question is this, and I'm going to rephrase it a little bit. How do we work in concert to engage businesses, employers, bankers, and others to invest in a living wage and nutrition security in our communities?
This morning when I talked about the racial wealth gap, and I talked about the fair housing laws, and I talked about the Fair Labor Act, how many of you were intimately familiar with those policies? Great. All 8 of you, yes. And so I think a big part of this is not only knowing the policy, but really breaking down the impact that it had on specific societal groups. And once you get not only the behavioral impact that it has, the health impact, the economic impact is where you really get their attention. When you start talking about in the next 5 to 10 years, which is right up the street, that employers find it in the next 5 to 10 years they would be unavailable to provide health benefits, that should be alarming because 65% of the workforce have some type of ailment at home where they're unable to work. If we're talking about competing in a global society and half of our workforce is sick, how are we going to compete? And you're afraid of robots? So I think having these conversations on how it not only impacts society and our ability to compete, but also how it impacts our pocketbooks is how we bring people to the table to get them to see their role in this. Yeah.
Please, let's give Rayna a round of applause. Rayna, thank you for joining us today, and we look forward to having you stay with us. And if people want to learn more, if you want to say hello or learn more about what Rayna has been writing and working on, please. Thank you.
Hi, everyone. I am Chris Simmons, Medical College of Wisconsin. I'm an associate professor in the Institute for Health and Equity and have been a community engaged researcher for the better part of the last 2 decades. I get the joy of moderating a wonderful panel today on community academic partnerships, and we're going to do that from multiple perspectives. We're going to talk about it from the perspectives of academic partners, of community partners, of people who've worked in private sector, nonprofit, government, and academic spaces. It'll be important for us to be able to understand the context of what community partnership means. Please note that you've got little snippets at your table. Please write questions as you have them. Someone will be coming around during this section, and we'll make certain that we've got time at the end so that we can ask and answer any questions that you might have. Could you put up the PowerPoint slides for me on the screen, please? That'd be great. So first thing I'd like to do is I'd like to introduce our panel. I apologize, I don't think they're quite in the order that they were on the slides. But first, Dr. Leslie Ruffalo. Dr. Ruffalo is a faculty member at MCW in Family and Community Medicine. Next, Dr. Yvonne Greer. Dr. Yvonne Greer is one of my mentors that I've worked with for, wow, almost 25 years, right? And she'll have plenty to teach us today. Viola Rembert, who is at Heart Love Place, a faith-based community organization that works very closely with community around health. And Vera Roddy, who is a veteran herself. Thank you so much for your service, and a veterans advocate and community partner. So what I would love to do is I'm going to set the table by just giving us a little overview of community engagement and community partnership. And then I'm going to turn it to each of these panelists to introduce themselves. We'll ask a few questions and we'll have a conversation. If at any time you have questions, communications, please let us know, and we're happy to engage in that way. Could you advance to the next slide, please? Thanks. Oh, there's a clicker. Wonderful. That helps me greatly. Look at that, I can do it. This is the spectrum of public participation. How many of you have seen the spectrum of public participation framework before? Anyone? Great. So this is really important because it underpins in community academic partnership a bit of what we do. And our keynote speaker, Rayna Andrews, did such a wonderful job prior of asking us to interrogate what our roles have been and are when it comes to equity and when it comes to promoting equity. Rayna was talking about food insecurity, but we can expand this to all of social determinants of health, healthcare, and community engagement. What's crucial here is that we need to move, and we need to move mindfully as institutions, as organizations in partnership, from this early notion of information to empowerment and true partnership. To ask difficult questions of ourselves so that we can effectively partner, so that we can share in the process, and so that decisions that are made about community health, about community wellness, are decisions made by community. Decisions made for community and in partnership with community. For far too long, we haven't done that. So the framework today is going to be based on that spectrum, and it's going to be based on moving away from informing. We're going to let you know what we do, that transactional nature of partnership. We need your data. To empowered partnership, where communities make decisions about factors, information, and systems that are important to them, so we can create sustainable change in health. This is a great group called Chicago Beyond that does community engagement and does it really well. I don't know how many of you have seen Chicago Beyond's work, but take a look at it. They were doing absolutely incredible things. And this 7 inequities held in place by power, 7 opportunities for change is a framework that I like to use when working with students in public health, and that I like to use when working in community. And a couple things I want to identify here. When we're looking for areas of impact, we can look for things that are traditional within the academic and academic health space and that are really commonly used within the community academic partnerships framework. So when we think about things like access in all areas, access to information, to data, to resources. Let me give you an example. Has anybody ever asked themselves why indirects are commonly paid to academic and academic health institutions, but indirects don't always come to nonprofits and community organizations? Viola, you asked. Yeah, I knew you'd ask. That's all right. Information. Information is absolutely crucial. And information and transparency and information about what our aims, what our intentions, and what our partnership looks like. Validity. What's the truth as we know it? Far too often as academic health institutions, we use our lenses to portray our truths when we disseminate information, as opposed to fidelity checking and working with community and community partners to talk about what our shared truths are. Ownership. Who owns the process? Who owns the work product? I can tell you this, and I state this all the time, and nobody likes to hear it from the academic partnership side, but it's truth. I don't know of a community partner that routinely looks at the impact factor of the journals we publish in. So if we're thinking about what ownership of work product looks like, what resonates with our community partners? What does work product and what does equitable work product look like from all perspectives? So that this isn't an exercise in maintenance of academic hegemony, but it's instead an exercise in shared utility, so that we've got sustainable change. Value. What's the value to us? We have to be transparent about what our value is. We do get grants. We do write reports. We do publish. That's important. But that can't be important at the expense of the benefit and value to community, to impacted community, and to our partners. Accountability. It's showing up even when there's not a grant, even when there's not funding, even when there's not an ask. Yvonne, we talk about this all the time. You can't show up the first time you meet a community partner and have an ask. You can't show up the first time you meet a community partner and request data. How about you sit down and listen? And ask a community partner not what's wrong with you, and this is stolen, this isn't mine, but what's strong with you. What's happening in community, what's important, what's interesting, so that we can build a framework together to support change. I think I've gone through all of these. I am now going to turn it over to my partners here, because I've talked too long already, to let them introduce themselves. So, Dr. Ruffalo, can we start with you? You want to just tell us a little bit about what you do and your ties to community partnership?
Sure. Can everybody hear me okay on this mic? Am I mic'd up okay? Yeah, so I'm Leslie Ruffalo. I am faculty at the Medical College of Wisconsin, as Dr. Simon mentioned, in the Department of Family and Community Medicine. I'm coming up on 16 years at MCW, so yeah, they hired me when I was like 10. No, just kidding. It's feeling a long time. It's feeling home. My role at MCW is really as a researcher. I am a community engaged health equity researcher. I've had this track record of when I look across my grant portfolio for the last 16 years, I have never done a grant without a community partner that has co-facilitated that grant with me. So it's a record I'm pretty proud of, and definitely something that I will maintain throughout the rest of my career. So for me, in my approach as a community engaged health researcher, the most important thing for me is to know what's pressing in our communities, to work with a community partner and let them really drive our agenda of the needs that we need to address. I think one of my approaches is to always believe the community partner. So that starts, I think, from day one. When you tell me that this is the reality of your community, that this is what the individuals that you support, what they're experiencing, I believe you. I believe you. I'm not the content expert. I'm not often in the in-group of that community, and so I believe you. And I think that extends throughout the whole duration of the partnership and hopefully sustained beyond any formal project that you have, any grant funding. And so I think similarly, if there is grant funding involved or a formalized work plan involved with what brings the community academic partnership together, throughout that entire process, if a community partner would come to me and they would say, Leslie, the way we said we were going to do this just doesn't work. I'm like, okay, it doesn't work. I believe. And so I have a dear community partner in the room right now, Tanya Potter, who's up in the Eau Claire, Menominee region. And we've had an Advancing a Healthier Wisconsin grant for several years now, and have actually had a couple of grants together. And we have these conversations all the time. Wow, this just really isn't working. And so we make those pivots. We make those adjustments. We trust each other. And I think that really does raise the impact of the work. I'll say one more thing and then I'll pass it on to Dr. Greer here. But the other kind of fortunate thing in my role, so kind of one half of my role being in research, the other half I'm at an academic medical center, so I'm an educator. I get a great opportunity to teach medical students and teach graduate students. And for me, I feel like that is the most important part of my work because I am hopefully influencing our next generation of community engaged healthcare providers and also our next generation of community engaged public health practitioners. And so the ability to have a grant or have a community academic partnership and bring students into that mix and see how they transform through those experiences of working with our community partners and how it enriches their understanding of what the real world problems are. A lot of the medical students that I've worked with and graduate students that I've worked with, they live a little bit in a bubble. They do. And so to be able to be and to witness that and be a part of seeing them have some of these breakthrough learning moments around the types of patients that they're going to take care of someday and the types of communities they're going to serve is really exciting work for me. So I'm happy to be a part of this panel and share a little bit more of my background, but I'll turn it over to Dr. Greer.
Thank you. Well, yes, I'm Dr. Yvonne D. Greer, a DRPH, Doctor of Public Health, a registered dietitian, an RD, and a certified dietitian with the state of Wisconsin, a CD. And so now I've got enough letters behind my name to actually finish my book. It's going to look good on that. But one of the things that, as Chris said, we've had a long engagement and connection is that we are both part of a group called the MCOP, the Milwaukee County Organizations Promoting Prevention, but it's had many names over the years, and we've stayed together through grants and without grants. There's this time that maybe there's a 4-year gap before we were able to get even more grants, but we came together as people concerned about the community, wanting to promote health and wellness in the community, and multi-sector group with from academia to schools to community members, all sorts of different groups coming together. My professional career, I will say, started out at the St. Luke's Medical Center as a cardiac surgery and intensive care unit dietitian. I was on the heart transplant team, and so I followed people from the time they came into the hospital, built them up to get through the surgery, followed them all through in the time they were in intensive care units, and then also taught them how to eat to live before they left. And someone said, I can teach everybody anything, but you get into people after the fact. They say you need to be in prevention. And so I left St. Luke's, went to the health department, worked there for 22 years. So I've been in the field a long time, was on the Governor's Council for Physical Fitness and Health, has been on the Academy of Nutrition and Dietetics National Board of Directors. Got all of these accolades, but what I really enjoy is the community work. And so I retired after 22 years at the health department to go on to run my business, Why Eat Right, full time. And I can now say that I've been full time with Why Eat Right for a good 10 years, and is still working with the state of Wisconsin on grants. We just received 2 CDC grants that's going to be bringing in about 1.3 million combined over the next 3 to 5 years to do social determinants of health, community engagement, but solutions and implementation and mobilizing the community and doing all of those great things that many of us say we should, do community-based participatory research. And sometimes we just, like you say, get that information, and maybe give a little information, but not actually get the community as true partners in what goes on. And in one of the work that we did, We were so surprised because we did include the community and we did, look at equity and we honored them. We referred to them as our community member experts, so our community experts, and we compensated them for their time and their energy. And when it came time to have a big planning conference that we thought, oh, we have to give it to them during the day, they won't be able to come, we were surprised. They took vacation days to be there. It was of value to them. And they said the biggest thing they found is no one asked us to participate like this. Mm-hmm. And so now our next version is we're going to have these community health action teams of community members actively working to identify and to mobilize and to be active members in promoting health and wellness in the community. So it's kind of like our next version, our extension of MCOP is to really get people going. I'm going to stop there. Oh, I will have one more thing. I am an instructor at Mount Mary University in their master's program. I do a community nutrition program management course, but my students have to do experiential learning so that they have hands-on experience in working in the community and grant writing before they actually become full-fledged dietitians or public health individuals. And I'm also connected with MATC. I have a field experience student and on their advisory boards for their nutrition and dietetic technician program. And so I really do promote uplifting our future health force, whether it's public health, whether it's dietetic, that we need to uplift our students. And so I'm very happy to be connected with the medical college as well. So I turn it over to one of my colleagues that work close with me, Viola Renberg.
Good morning, everybody. Good morning. Oh, come on, you all could do better than that. Good morning, everybody. Good morning. So I don't have any letters behind my name, but I am the executive director of a nonprofit Christian ministry located in the Harambe community called Heart Love Place. I've been there for 14 years. Heart Love Place has been in the community for over 30 years. We're a pretty quiet engine that could. And I like to say that we are the boots on the ground. This area of wellness and health in the community is near and dear to my heart. I am diabetic. I am a cancer survivor. I have high blood pressure and multiple sclerosis. So hopefully I don't look like I don't display that, but I try to take care of myself. So these health issues that are impacting our community is so important to the work that we do at Heart Love Place. So for those of you that don't know, we do a lot of stuff focusing on the inner city of Milwaukee. About, I don't know, how long have I been associated with MCOT? Like 7 years? So 7 years ago, I met this wonderful woman, and she's invited me to come to a meeting. And I realized, this was really an area at our ministry that we weren't really paying attention to, wellness. So we started making some changes, and we actually put this as one of our focus areas, health and wellness. The 53212 zip code that we serve has the highest rate of diabetes in the city of Milwaukee. Childhood obesity, some of those things that we've addressed through MCOP and have done some stuff. We have a community garden. Come by. It's on the corner of King and Ring. It's beautiful. It is beautiful. Trying, like Rayna said, educating people on, making healthy choices, right? And the younger, the better. So for me, I've been doing this work for over 30 years. I've been in nonprofit management. I'm not from Milwaukee. I am now, but I moved here from Brooklyn, New York. And when I came here, I never saw nothing like Milwaukee before in my life because I'm a Brooklyn kid. I never saw such a clean city. It was very clean back then. I moved here in 91, and there was no traffic. And all these things impact health. Something as little, the cleanliness of a community, traffic that we drive in, We know we get stressed out. So for us as a boots on the ground community organization, it is so important for us to be just that, boots on the ground. We are in the trenches with our families. And guess what? Our families want the same things that you want. The same exact things. So the one thing that parents or people say when they come to Heart Love Place, they say, we don't feel judged, we feel loved. See, I got my little heart on for a reason, you know? And I almost feel like everybody that spoke beforehand kind of hit on everything that we're gonna talk about too, but what is your why? What is your why for doing what you do? I know my why. What is yours? The things that I think about when I look at the city of Milwaukee with all the resources that we have, and you all will agree, we got a ton of resources in the city of Milwaukee in terms of nonprofits and foundations and organizations like MCW. I mean, there's a lot. With all of that, how come there's still struggle? I want to see that needle move a little further. So that's a little bit about Heart Love Place. Go to our website, heartloveplace.org, to find out more. I love the work that we do. I love that we are right in the trenches, and we're going to continue to be in the trenches. Thanks, and I'll turn it over to the next speaker.
I'm Vera Roddy. I'm an Air Force veteran. I served 15 years in the Air Force and Air Force Reserves. I have one stateside deployment and one combat tour, where I did aeromedical evacuation off of the front lines, and so my subspecialty is combat psychiatry, based on Air Force criteria, not medical college criteria. I've been connected with the medical college through a number of programs. I participate in the Warrior Partnership Program, teaching the M1 students about how to interact with veterans. I've been a part of Katinka Hoyer's Warrior's Path program, looking at moral injury. Because my background in mental health, I'm able to take traditionally male stories. We use a graphic novel. And so taking that traditional male story and kind of reframing it in female terms and working with female veterans. So I've had several groups of female-only veterans go through the moral injury program with great success. My side hustle is working with the congressionally directed medical research program in Washington, D.C. So I do research on well, I don't do the research. I fund the research for toxic exposure. So if any of you are researchers and your thing is toxic exposure, come see me, because, again, I am boots on the ground with toxic exposure, having been exposed to the oil well fires and other factors during desert storms. So I'm 100% service connected. And so I will leave you with a question as part of my opening remarks. What do you do when you're 33 years old and you come back from war, you're 100% disabled and not expected to work for the rest of your life?
Thank you, panel. That's really absolutely an outstanding introduction. And as you can see, we've got a really, really excellent and broad group of interactions and community partnerships here. Vera, I'm going to start with you because you hit on it. You are a member of a very elite and very specific group in that you're a veteran. But within that group and working with that group comes some peculiarities and some interesting connections. I'm going to ask you, can you please discuss a little bit about your background and your experience as an insider and in some ways an outsider in connecting both within that community and connecting that community to the broader academic community?
I'm going to put my hearing glasses on so I can, so I don't miss anything here. So I think the important thing is, first of all, community engagement framework. You know, I had to look that up. What does that mean? Because what you guys use terms that I don't know. And I looked it up and, well, good gosh, it's military leadership. So putting a team together with a mission and being able to carry out that mission. And that mission might include civilians, it might include NCOs, it might include young airmen, it might include officers. And I have to be able, as a senior NCO, I have to be able to negotiate all of that. And so military leadership really plays a factor in community building or community engagement. I look at the medical college folks as my officers, so I oftentimes tease Katinka Hoyer that she's my LT, my lieutenant. You know, I do what she tells me to do. And usually it's like, go find me some veterans. And so I go out and find her some veterans. Let's see. So insider of the veterans community. So I think the thing you should know about the veterans community is we have our own culture. We are not geographically bound. So I have a national reputation in the veterans community. You know, Facebook helped propel that, but I had one even before Facebook was a thing. Learn our language. We have a very unique kind of language, so we use a lot of acronyms. You know, I mean, I'm an NCO. What does that mean? I'm a non-commissioned officer. You know, I came up through the ranks in my 15 years in the military. So as an outsider, so I'm the rogue agent at this table. You know, so the guys on the flight line gave me, my name is Vera Roddy, they gave me the name Very Rowdy, but I'm rowdy only in the kindest and most gentlest of manners. But as the rogue agent, because I'm not accountable to anybody, I'm just a person living in the community, right? I can go out and I can do things that you can't do. So you might not be able, especially VA people, they can't, as government employees, they can't solicit donations, but I can. So when they need, you know, snacks, because if you feed them, they will come, right? If they need snacks, I could go to the American Legion or the VFW and say, hey, you want to spend some of your money on veterans? Let me give you this program that we're sponsoring. And a lot of times they'll come forward and pay for the thing. You know, that's how we got the American Legion Auxiliary to sponsor funding for homeless women veterans, which was a significant lack in our community. I helped stump for Boudica House, a place to house our homeless women veterans, because women veterans will not leave their children to seek treatment. And so now we have Boudica House, and they can have children staying with them. And that has expanded to many other things. So we have the HUD-VASH program now. I was rowdy once on the streets of National Avenue in front of the VA. We actually held a protest to save the Soldiers' Home, that big old building in the historic district. You know, the city wanted to come in and build Starbucks and condominiums, and we're like, no, that's set aside for the veterans. So a bunch of us got together, and we actually beat the city, and we now have 101 veterans living in the historic district. So sometimes being a rogue agent is good. Do you want me to continue on, or you go on to the next? You have to give me the, because I'll
If
talk
you've
all
got
day.
more to say it. This is great.
Okay, so I started the Artful Warriors. You'll hear from Dry Hooch later on. But Dry Hooch is a veterans coffee shop on Brady Street, and when they opened, I started the Artful Warriors as a coffee house kind of art thing to do. And we'd come with a little project to do, and pretty soon community partners would start donating, you know, art supplies. I'd come in and there'd be a bag of art supplies on the table for us. It started out with just women, but then the guys, the male veterans, were like, hey, what are you doing there? That looks really interesting. So we just took a vote and said, can our brother veterans come and join us? And of course the vote was yes. And so they joined us, and it was a resounding success. I had it for 5 years. I did turn it over to another veteran, and sadly it's gone by the wayside, but lots of stuff does. And it wasn't so much about doing art. It was a way for me to wag my finger at somebody who walked in the door and said, you know, come join us. So it could be a community partner, it could be a veteran's family member, a new veteran to the community, somebody that is looking for help. And it was a way for us to engage in a conversation. And veteran stories need to be told, and they need to be witnessed by our community partners, so our families and our neighbors. That went on to become, so then later on, I caught wind that there was going to be some some symposiums on arts for the veterans community, military veterans community. The Vietnam vets at Dry Hooch passed the hat and gave me $350 to pay my gas to drive out to Washington, D.C. in my blue jeans and my waffle stomper boots and my Dry Hooch t-shirt, and all those guys are like, you know, the high mucky mucks, because they're talking about policy and, you know, procedures and funding, and I'm there as the rogue agent saying, we can't wait, we need this stuff now. I'm happy to say that now we have come full circle. We have funding here in Milwaukee for veterans arts programs, primarily with Donna Alexa Art Centers, who now has a women veterans art program, open studio art program on Wednesdays, and both genders on Thursdays. And Art Therapy House up in Brown Deer has a veterans program doing digital art. And that's all funded by the National Endowment for the Arts. But I was honored to be able to be out there and stump for this and to see it come full circle. And how that's meaningful, I brought that back to the Vietnam vets that raised that money for me by passing the hat and said, look what you guys did. This is your legacy. And as I'm talking to them, I'm like, you have planted the seed of advocacy and volunteerism in me, and it's my turn to pass it on to the next generation. And as I'm talking, they're sitting a little bit taller and feeling a little bit prouder, and their chests are coming out because they got a bad shrift when they came home. And I'm here to say that they have done fabulous things in the community. They just done it very quietly. Shall I stop there?
That's outstanding.
Okay.
Yeah, thank you so much, Vera. All right, Viola, you described the little engine that could when talking about Heart Love Place. I've always thought that that's an apt descriptor of you, honestly, since we started meeting each other at MCOP, 7 years ago. And wellness wasn't necessarily a driver at Heart Love Place, but you made it a driver. You drove that. I want to ask you the question that is really pertinent to what happens in Milwaukee, because faith-based organizations do so much around social determinants of health, around institutional oppression. In your organization, how do you develop lasting relationships of trust over time with families?
Thank you, Chris. Good question. So this is going to be an interactive response. So the first thing I want to do is define the word relationship. So just give me a minute to pull it up on my trusty cell phone that I've dropped like 50 million times and it's broken. But anyway, the definition of relationship says the way in which two or more concepts, objects, or people are connected. Connected. Or the state of being connected. So the word relationship here is really important, right? How are we connecting with others? What do you want in a relationship? Who in here is in a relationship? Raise your hand. Everybody's hand should go up. Everybody's hand should go up. What do you want, Dr. Young, in a relationship? Peace. Peace. Young lady here with the beautiful dress on, what do you want in a relationship? Trust. Oh my God, I love it. Right here, what do you want in a relationship? Conversation. And one more, what do you want in a relationship, Kelsey? Say that again. Communication. The list can go on and on and on and on. So how we build trust at Heart Love Place, we do that and more. So it's not rocket science, people. Everybody that's in this room, I feel like I'm preaching to the choir. And I am, but there's some missing links. There are clearly missing links because there's a lot of people slipping through the cracks. Now, on the other side of things, I am more optimistic than pessimistic. And what that means is that I believe my Milwaukee is so dope. I love Milwaukee. So many great things happen in Milwaukee. Would you agree? But we don't hear it. We don't hear it. There's more good happening in Milwaukee than bad. Do y'all believe that?
Yes.
So we have to start turning that around and telling these stories, number one. The other thing is we have to include the people that we're serving in the plans. Why aren't they at the table right now? We do that. We've done it as nonprofits, as in this community. We say what we think the community wants, but do we really know? Right? So again, This word relationship is important. What does that look like for you? Meaning, what is that why? We cannot sit behind our desks. We cannot have a grant, come into the community, do the grant, and then, oh, goodbye. Because guess what? The community is getting tired of that. So I get calls from people at the medical college that says, Viola, can you help me find people, blah, blah. We've all gotten those calls as nonprofits. And my first question is, what is going to happen after the grant? After it's over? So critical to us as a ministry and as boots on the ground is that a relationship has to be purposeful. And guess what? Every relationship ain't for everybody. Let me say that again. Every relationship is not for everybody. Who's been in a bad relationship before? Come on now. There's a lot of women in the room. Raise them hands. Every relationship is not for everybody. Be purposeful with who you're partnering with. Be purposeful. No, the only way you could be purposeful is if you know your why. I know my why for the work I do. I've been there for 14 years. I have never been any place for 14 years. I've been at this job. I've worked in New York and Cleveland and Milwaukee, and this is the longest I've ever stayed any place because I discovered my purpose. So building relationships is everything that you guys said and more, but you gotta be purposeful, you gotta be boots on the ground, and what happens after is so important, and inviting them to the table like Dr. Greer said. They want the same things you do. They want, like Rayna said, house, employment, food. Something as simple as food should not be, it should be everybody's right to have it. But yet, in 2024, we are still talking about food equity. That doesn't make sense to me because there's too many smart people in this room. It's too many smart people outside of this room. When I go to a school, so we partner with schools. So partnership. So we partner with schools, we partner with other nonprofits, we partner with neighbors, we partner with everybody. When I go to a school, a public school, the one thing I do all the time is we bring good food, like your mama cooks. And those kids eat it up. Number one, they're hungry. It may be the only meal they're getting, even though MPS is feeding people, I'm gonna just be real. It's not the best food at some of these schools. Why do we continue to let this happen? And then we wonder why kids can't concentrate. They can't concentrate. They're getting into fights. They're doing this, right? If we're talking about relationships, have a conversation with a teenager. Have a conversation with a teenager. They will tell you what they want. And I'm sorry to say it, we are not listening. Somebody said, relationship, what you want out of relationship. Who said listening? Somebody said it. Somebody said listening. Talk to a teenager. Talk to a young person. They will tell you what they want. Where we're missing, we're not really listening. Because if we were, I wouldn't have kids saying, I don't eat that school lunch. That school lunch is nasty. That's ridiculous. And then we wonder why they're falling asleep in school, getting disruptive. Come on, things are falling through the cracks. And it's a simple solution. So how we build relationship is very grassroots. So MPS won't change. The one school that we're going to, we're bringing food. We're bringing food. How many other people could come bring some food? And we bring, again, food like your mama cook. We ain't bringing a mock chicken leg. We're bringing baked chicken, barbecue chicken, mashed potatoes, spaghetti with meat sauce. I remember one day, one of the kids was eating, and he said, "Who is the cook, Miss Viola? Tell her I love her." That's powerful. So how you build relationship is all those things that you all said, but we cannot keep letting things slip through the cracks. Those babies that are in school right now, they're going to be taking care of you. Think about that. They're going to be taking care of us, right? So we have to stop letting things slip through the cracks. I just want to share a couple of other things as it relates to building relationships. One of the things that Rayna asked was, how are we feeding America? How are we feeding America? That is such a powerful statement to me, because when I think of feeding, I don't just think about food. I think of how we feeding the spirit, how we feeding the mind, how we feeding the emotional wellness of a person. All of that is so important. I remember having a conversation one day with our alderwoman, which is Malele Coggs, and she was talking about all the abandoned houses in the inner city, right? We all see it, right? We see it. But imagine that kid that walks out that door every day and sees that in their neighborhood. 5 houses on their block, abandoned, trash. Imagine the single mom, the dad, whoever that walks out and sees that every day. It has an impact on that person. So that relationship is so important to feeding not just with food, but the whole person. The whole person. It is not rocket science. It really is not. I know we got a lot of researchers in here, but it really is not that hard. I think sometimes we make things harder than they have to be. And for me, I also, when I was younger, like in my 30s and my 20s, I had this thing where I wanted to save the whole world. I got to save the whole world. Really? Now I say, can I just work one block at a time? Can I be more strategic and focused on what we're doing through our programs and services? So building relationships, you all know how to do it. You know how to do it. I'm just saying, I'm going to challenge you, take it to the next level. Take it to the next level. It's important. There are people slipping through the cracks. Thank you.
Thank you, Viola. Dr. Greer, you've had such an incredible and diverse set of experiences in your professional career working in private sector, community-based organizations, government, health, and other. Can you talk to the group today and explain what do academic and academic medical partners need to know about building equitable partnerships with community from your perspective, because you've seen it from multiple sides?
Well, thank you for that question, and I tried to put a lot of thought into it, but I wanted to make sure that I talked about the basics, and I think many other people have already mentioned some of the same things that I'm going to say, but I'm still going to go ahead on and say them in the way that I know. I believe academic partners need to know when working with the community that there's always something that you can learn from the community. So to come in with an open mind, to learn and to share. So, although you may have all of what they call book learning, the research, what are the issues in the community. Many times people say, I want to make a change, a positive social change. But you have to know that the community are the experts in their own survival. They're the experts in how they have to move through this world and through their time. That you should take time to talk, and actually you take time first to listen and to be open to learning how they can assist you in doing whatever you want to do. So a lot of times, you think, well, we're going to go and come in there and we're going to, implement this program and things, and they might say, oh, no, that ain't never going to work. You come in like that, you'll never do it. And so you have to really come in there with an idea that I have a mission, but I am trying to come into a community who has expertise in their own community. So if you come in, with an open mind, you'll find they will be the ones that help lead you to a successful outcome. But know, this is what I want to make sure, but know that if you wrong someone, the word will get out. Yes. The word will get out. I mean, you come in and say, oh, they didn't care about what we wanted. They didn't ask us this. They didn't try to see what we've already been doing. They just came in with their own agenda and da-da-da-da, and then the word will get out, and somebody else will say, have you ever worked with them? I wouldn't even be bothered. And then you get the people who won't return your phone call, wonder why. The word on the streets. When I first wanted to do my doctoral research, I wanted to do it on the power of the word of mouth. Because the community has a communication system that I don't even know how it works. You could see something on the news, and the news is reported one way, and I'll go say something to my sister. She said, oh, no, that's not the way it is. Mm-hmm. The word on the street says this, and this. And if the word on the streets get out that somebody is not genuine and they want to come in and they want to do this and that, you'll be surprised how you won't accomplish things in the community. The other thing that I wanted to do is to really talk about, again, the trust. We all have some of the same thing, trust building. I did my doctoral research on social capital and food insecurity, and was really surprised to learn that food insecurity can be generational. Social capital and social connections can be very key to what goes on, and if you have low social support and social isolated and poor access to things, it can actually change the trajectory of a child's life, even their success, even their relational health with other people. And so building trust is a big thing that we do, and with some of the grants that I've been working with, these are some of the frameworks that we've been using. Restorative justice framework, wherein we recognize that there has been traumatic harm that has been done, and we are working to bring those who have been harmed together with the systems that have perpetuated harm, and to be able to forge some type of connection, some type of understanding that, yes, we do want the best for the community, and you can develop solutions together as you go forward. This honesty piece is important because it's saying, I see you, community, I hear and I know your pain, and we're now at the point where we just don't want to document the pain and document the problems and document the way it is. Now we want to do something to implement solutions that's going to change the trajectory of the lives of children now and into the future. That's just one. ABCD, asset-based community development. Looking at the assets. You do a community needs assessment, and then you're documenting all the negative things. What are the assets in the community that you could document? There's always the flip side. If you say that 60% of the children are graduating from high school, that means 40% are. What are those parents doing? How can we duplicate what those parents are doing? We talked about having obesity prevention. Our program flipped it around. We want healthy and fit children. And what are those healthy and fit children doing, and how are their parents supporting them, and how can we promote that positive? So taking it and flipping the switch, collective impact. Generally wanting the community to be part of the solution. Not just give me some ideas of this or ideas, but actually generally working them in as active partners in what you're doing and honoring what they bring to the table. And then the last one I'll bring up, then we're using all these different things in different ways. Actually, it's two that I can bring up. Results-based accountability. Results-based accountability is really looking at the ends in mind, having a mental model where you want to go, that positive thing you want to create, and then looking at all the variables and prioritizing what needs to be done so you can be and achieve, and the community can see the achievement, so that it's a positive framework. The one that I said, it was the life course initiative, kind of like baseline, you know, knowing that from the very beginning of life, that it's going to be affecting all the way through to the end of life. And so that life course perspective, not just always taking a segment here and working with a segment there, but how do they all come together to create a healthy culture that promotes health and wellness for all? Those are the types of things that I'm working with. The grants that I put together have those type of frameworks, always looking more to what is the solutions versus just documenting the issue. How do we promote the positive? How do we create wherein people want to be part of that positive? Because they say, as your friend, what your friends do, you do. How do you become an ally? I was in Michigan just last week doing a talk on ABCD, and one of the ladies said that she has been really trying to promote allyship, and that some people feel like it's like an insult if they say, oh, you should come in and be an ally to the community, and some people say, oh, you think I'm different than the community. Well, people do have different perspectives. You know, you come into an African-American community, if I go into a Hispanic community, I'm not gonna go in there acting like I know everything, or I'm just the same. I'm not just the same, but I can become an ally. I can learn your issues. I can help support you in your initiatives that you want to get done. I can help you, do what you need to do, but I have to be humble enough to ask and humble enough to know that I just can't come in there with all the answers. Even if I come in there with an agenda, we want to increase heart-healthy living. Now, I can't make you have heart health. You can make you have heart health, or you can do the work. I can support you in that work. So that's where becoming an ally, collective actions, being able to be part of the solutions, but not coming in there with all the answers. And this is one thing, and I'll end, knowing that you can lead from behind. That came from Deborah Nevels, one of my counterpart here at Medical College of Wisconsin Cancer Center. The idea that you can come to community and you can listen and learn, and you don't have to always feel you have to be the one to just get them together, and you can lead from behind, and they will ask you, to give us some more information. They will identify what they don't know and what they would like to know more of, and they will be open and supportive, and then once you're in, you're in. Once they know that you have a good heart and you're there for the community, then the sky's the limit of what they will help support you in doing and how it's going to benefit the community. They will see it as well. So I'm going to stop there.
Thanks, Dr. Greer. I really appreciate it. Dr. Ruffalo, so we've talked a great deal about a variety of different spaces here. One of the things that we don't talk about enough in this space, because we are housed in Milwaukee, we tend to talk about the social determinants of health and the issues facing the city. You've had a lot of experience as a community academic partner in rural partnerships. So I'd like you to just spend a few minutes, if you would, talking about the uniquities there in the context of working with rural partners.
Perfect. Well, I'm happy to bring up the caboose when we're running out of time, because I could listen to these three ladies all day. So before I dig into that, I want to double back on one of Yvonne's comments around, and I'm going to speak from the academic perspective, to her notion around letting our community partners be a part of the solution. And I'd actually push that further and say, let our community partners lead the solution, and to take that back seat and let them lead it, and find out as academic partners what our role is in supporting that change, and letting them lead. And then I'm also going to come full circle, and actually the full circle moment with Vera's comment is that when we do that, when we as academic partners when we let that limelight go away and we are just a supporter, it allows those rogue agents to do their work and you just step out of the way. So I love that part. And then I love when Viola was talking about relationships, how we've all been in bad relationships. And I just want to mention that for those of you that have had experiences working with academic partners that talk about community engagement, is just to think about how there's all flavors of community engagement. So you may have worked with one academic partner that practices a certain flavor of community engagement. And if that's the case, you've worked with one community or academic partner. So, get to know a lot of different academic partners if that's something that you have the ability to do, because we all do it a little bit differently, I would have to say. Now, coming back to the question about how do we work with our rural communities? So this is a really personal topic for me. I grew up 5 hours from here in northern Wisconsin in a small rural community of about 2,000 people. And so when I came to the big city of Milwaukee, right, and I love what Viola is saying here. I love our city of Milwaukee. I love this area. This is home for me now, not little itty bitty small rural Wisconsin. And, I had to battle the concerns around my parents, like, oh my gosh, Leslie's living in Milwaukee. How can this be? But I love it here, and because we have so much to celebrate. We have such great stories to tell. And I love how Viola was talking about relationships and how relationships matter. And one of the things you kept saying was, our communities, they want the same things that we want. And I would say that's true about our rural communities. What we want here in urban Milwaukee, our rural communities want those same things. They want better access to mental health services. They want better access to healthy produce. They want access to better schools. And I think we have to just keep that in mind, that there is such a humanistic element to health equity and a unifying trait of we all want the same things. We all want the same things for our kids. We all want the same things for our older adult aging population. We all want the same things for each other. And so whether you're urban, rural, whatever it might be, I think just keeping that in mind. The other thing I'll say is, if you ever have the opportunity to partner with a rural community, go for it. There's so much, I think, co-learning to be had in that. I would say one of the biggest gaps that I've observed is that so many rural communities struggle to find the front door to MCW. Like who I don't know anybody that works at MCW. I know there's a lot of resources in that institution, but I don't know how to access them. So I think just helping people find the front door, whether again they're urban, rural, is also kind of a key calling that we have as academic partners and those of you who have found that front door to MCW. So I'll leave it at that.
Thank you. Vera, Viola, Yvonne, Leslie, thank you so much for your time and for your expertise and for sharing with us. You could each do an hour, I think, and I think we'd still have plenty to talk about. Did anybody have any questions quickly as we move forward? Or did anybody have a question that was written down? I'd love to be able to ask a few of the group. Sure. Okay.
In terms of veterans and when we engage veterans in the community, or
He's asking a question.
our veterans are not the people to put themselves in the podium. They're not the people who have really given real sacrifice to this nation, are not the people who are going to be screaming, look at me and look at what I did, and because it comes from a place of service, that mission of service. So I really appreciate the work that you're doing, and I definitely gonna come and bother you a whole lot. But I just had to make the comment, real patriots don't go around with billboards. And real heroes don't talk about what they've done. They don't show you, they just do it. So that's all.
Thank you, ladies, so much for that. I just got a quick comment on what Ms. Viola said about the people we serve should be here, and I'm real big on involvement versus engagement, and that right there is an example of involvement versus engagement.
Thank you.
Any other questions, thoughts, comments? All right, well, we thank you so much for attending this session. Really appreciate your interest and taking the time to hear what these experts have to say. So really appreciate it. Thank you.
I have the pleasure of being up here with Mr. Otis Winstead from Dry Hooch, and so we wanted to take a few minutes to talk about Dry Hooch, and I'm going to introduce my friend. So, each year, starting last year, this is our second annual, in May, we are doing a supply drive through the Office of Community Engagement. And this year, our designated organization is Dry Hooch. And Dry Hooch runs a food pantry. They are an organization that you'll hear more about, but they're a veteran-serving, veteran-founded organization, and they run a food pantry. And so we are collecting throughout the month of May non-perishable food items to restock their pantry that supplies veterans and their families. And so I'm joined, as I said, by Mr. Otis Winstead. He's the president and the CEO of Dry Hooch. I have had the honor of knowing and working with you for probably the past 7 years. Yeah, and we bonded over our East Coast origins, among other things. And I'm really happy he's here today to talk more about Dry Hooch. Before I turn it over to him, I wanted to be sure to recognize something specific, especially since we're in the War Memorial Center. Otis was instrumental in organizing the African American Veterans Memorial Wall, which is here at the War Memorial Center. And the effort was decades in the making, and he catalyzed the work and the aspirations of many organizations, including the Milwaukee NAACP, the Wisconsin Black Historical Society, and the National Association for Black Veterans, all of which made this memorial a reality. So with that, thank you, Otis.
Thank you, Sarah, thank you. So my name is Otis Winstead. I'm an Army vet, Vietnam era Army vet, okay? I'm from Pittsburgh, Pennsylvania, and Anybody here from Pittsburgh? Anybody here? Is it? Very good, good. Do we have any Packer fans here? I figured that. Now, do we have any Steelers fans here? There you go. Okay, okay. So anyway, on behalf of Bob Curry, those of you who don't know Bob Curry, he is the founder of Dry Hooch. Okay, this was his vision, his mission. I'm not going to talk about his story. I'm just going to say he is the founder of Dry Hooch. And I'm pleased to be here to represent Dry Hooch today. Sarah talked about the food pantry. So there was some conversation about food insecurity. Right now, the veterans and their families are suffering tremendously. So we thank you for having that food drive for us. We probably serve close to 300 veterans per month with our pantry. But you know, due to budget and whatnot, Feed America, other resources are starting to downgrade and whatnot. You know, their resources aren't that. So, and this is the fun part for me, because I was thinking, okay, all these people that I know from the medical college, you know. So Sarah helped me put it together. I kind of told her the ones I knew and some ones I didn't know. So we're going to talk about our partners first. Mental Health of America. I think everybody's familiar with Mental Health America. They're a partner of ours. UWM, the VA, Marquette, and the Medical College of Wisconsin. Okay, those partnerships were instrumental, have been instrumental for the last 10 to 12 years in different projects that we've been able to do. When I talk about MCW, I want to call out the Office of Community Engagement. You know, we talk about community engagement, and like, I really didn't know. I always thought academics were like bookworms, really, just bookworms. You know, they could never relate to where we were coming from in the community. But I found out different over the last 12 years or so that the folks in the community engagement department really, really are invested in the community. And I'm not talking specifically about the veteran community. I'm talking about the community at large, you know? So big kudos go out to those folks. On that community engagement team, that would be Miss Sarah O'Connor, Kelsey Heindale. Where's Kelsey at? Oh, there she is. Okay. And Maya Patria and Tiffany Gray. Maya and Tiffany are no longer with us, but they were instrumental in a lot of projects that we did. I also want to talk about some of the key researchers. Now, when you talk about key researchers, I used to think key researchers, there were some academics there, researchers, that word, you know? But I come to find out folks like Dr. Katinka Hoover, Dr. Leslie Rufo, Dr. Konja Lord, and Dr. Syed Ahmed, they really became friends in terms of peer supporting Dry Hooch. You know, like Siri was saying, I met her walking up the side of a sidewalk. She's from New York, I'm from Pittsburgh, and we just kind of bonded there. I want to give a special shout out to a few people. They're not on this list. Jeff Whittle, another guy who he just really, you know, even to this day, hey Otis, you think we can do this? Yeah, we can do it, Jeff. And he's just been a real supporter. We're talking about community engagement. We're also talking about some recent partners like Kieran Dotson. Is she here? Kieran here? Oh, there she is, with the All of Us program. Really instrumental. You know, minorities, particularly, I didn't have a clue about what that was all about until actually Kieran came and sat down with me and communicated to me what the All of Us program was about. And she really took her time with me, which allowed me to go into the community, into churches, faith-based places, and talk about how important this is. So with that, the last person that I really got to give kudos to is Dr. Zeno Franco. He ain't even here. You know, he ain't even here. You know, I've been thinking about this for 2 weeks. You know, but he, you know, there were times, let me just say that community engagement was real important to Dry Hooch, but this relationship that Zeno had with us was really significant. I'm gonna tell you why. There were times when I said, I give up. Zeno says, no, you're not. You know, there were times when I said, I don't know if we can do this. Yes, you can. You know, so we talked over the last 10 years, 10 or 12 years about a lot of different things. A lot of kudos and gratefulness goes out to the college and these partners, but a special thank goes out to Zeno Franco because he continues to work with us. In a minute, you're going to see a video about all of the, I wouldn't say all of them, but a lot of the projects that we've done in cooperation with the medical college, okay? And that video is going to talk a lot about exactly what we do. If you have any questions, let me know afterwards. I should still be around. Thank you all.
My first experience with Dry Hooch was coming in for community service because I was facing criminal charges. And through that whole moment of when I walked in those doors to do community service, my whole career flipped.
Our motto at Dry Hooch is helping the veteran and their family who survived the war, survive the peace.
The thing that our military doesn't do well enough is they train you to go to war, but they don't train you to leave. And that's where Bob's philosophy of helping veterans and their family who survived the war survive the peace, that's why it's so important, because Dry Hooch is that transition piece.
15 years ago, we started Dry Hooch, which is a place veterans can get together and explain how they survived, what they did, so other veterans could learn from our experiences.
When I started off at the Dry Hooch, I learned that I could have fun again. I learned that I had other veterans around me that could keep me safe, friends around me that could teach me how to have fun. And the Dry Hooch is really supportive to all kinds of vets. Doesn't matter. If you wore the uniform, you're allowed here.
We're talking about integrating with the community. Just have a cup of coffee and sit around and just relax, and kind of allows the veteran to actually get to know the community again. We want Dry Hooch just to be your safe place.
We had things for vets, but we couldn't find a way to help the people that we're hurting. You know, I mean, as a veteran, the most important people in my life are my children and my parents and my friends and family, and they're the ones that are being beat up almost as bad as we are. Of course, they didn't have to go through the war, but they're still collateral damage of our own personal war. We started developing from the ground up over at National Avenue, a safe place for their family members to go.
The Dry Hooch Veterans and Family Resource Center provides services and support to veterans, the veteran spouses, parents of veterans, and adult children for veterans. One of the ways that we feel Dry Hooch helps that is different from maybe some other organizations is we try to fill in the gaps in areas that have been missed and help to alleviate some of the pain that veterans and their families are facing. We offer individual peer support for veterans and other family members, as well as peer support groups.
I work for Dry Hooch as a peer support specialist. I do a regular SOAR group, which stands for Set Free Others and Recover. SOAR is a support group that helps people with mental health issues, compulsions, alcoholism, drug use, mental health issues like PTSD. We feel that by sharing in a group, using a 12-step program, you can gain the positive effects of like going to therapy.
One of the big things with being a combat vet in the community is being around people that don't know what you went through, and you just get that feeling of loneliness. When you're out there by yourself, you're not around a group of veterans, you're not sure what to do, what to say, how people are going to react. And at Dry Hooch, everything's peer-led. Having people walking with you and guiding you, you just get that feeling of you're not alone.
So the QRF course means Quick Reaction Force, and we modeled it after an understanding that veterans hear the name, they know what we're talking about. And the training program is about 20 hours chopped into certain blocks of time.
The Quick Reaction Force made it so that if we got a phone call, that we could either be there in minutes as a quick reaction force to help, talk down a veteran, or they could come to the office and we could work through whatever they were dealing with face to face.
Veterans developed this program within Dry Hooch to be able to react to help veterans in the middle of a crisis be able to reach resources. We have an app called Battle Peer. It kind of piggybacks off our QRF program and our training, because when you were in the military, you never did anything else without a battle buddy. So Battle Peer is a way to be able to connect everybody, all the service members, to be able to have a battle buddy instantly and connect with them.
So this organization that I co-founded was Veterans for Diversity, and we coordinated that into our veterans family outreach so that we can have a spokesperson for veterans, and we can lighten that load as far as their LGBT status. Everybody's included at the Dry Hooch. Every gender, every race, every ethnicity, religion doesn't matter. LGBT status does not matter. What matters is that you are a veteran and you wore the uniform.
So the Hooch podcast is designed for veterans to be able to tell their story and be able to have somebody else in the audience connect with it, and thus hear somebody's side of the story that might not have been open to, but it's that human connection that they start to hear. Everything from an Army Ranger to, an Air Force cook.
We've had some awesome partners over the years, and we still do have these partners. The Medical College of Wisconsin, Marquette, we've had the UWM. We also had the VA Hospital, and they've been with us through this whole journey, and they're continuing to do projects with us also. If you know a veteran, or if you know a family member of a veteran who does need assistance, please, by all means, contact us at dryhooch.org, and we can help them get the help that they need. Contact us at dryhooch.org, and we can help get the help that you need.
Thank you, Otis and Dry Hooch, for all the amazing work that you're doing. Just want you to know that there's multiple ways to donate. We have a QR code. Go ask at the registration desk. You can scan that, order. The food will be sent directly to Dry Hooch. If you're at MCW, it's going on the whole month, and we have boxes throughout Milwaukee's campus. And with that, I am going to call Dr. Stacy Young up to introduce our afternoon keynote. I'm going to use this one. Yeah.
Great. Thank you, Sarah, and thank you, Otis. Hopefully everyone's having a great day. I see a lot of smiles throughout the morning. I stepped in and out of the breakout sessions, and there was just a lot of great energy, a lot of conversation. So again, we're glad that you're with us throughout the day. I now have the honor of introducing our second keynote speaker of the day, Dr. Jesse Ehrenfeld. Dr. Ehrenfeld serves as Director of the Advancing a Healthier Wisconsin Endowment and Senior Associate Dean and Professor at the Medical College of Wisconsin School of Medicine. He divides his time among clinical practice, research, and directing the strategic and operational advancement of AHW, which is a statewide philanthropy established by MCW to serve as a resource to health research, education, and community initiatives across Wisconsin. Under Dr. Ehrenfeld's leadership, AHW has awarded an average of $16 million in grant awards annually into community and health research initiatives aimed at improving health and advancing health equity in Wisconsin. In 2020, he led the coordination of AHW's rapid response to the COVID-19 pandemic, deploying more than $4.8 million in grants to partners across the state. He was named by Managed Healthcare Executive magazine as one of its 10 emerging industry leaders. Dr. Ehrenfeld has long advocated on behalf of lesbian, gay, bisexual, transgender, and queer individuals. In 2020, he was named a notable LGBTQ executive by Biz Times Milwaukee. Previously, he served as chair of the Massachusetts Committee on LGBT Health, chair of the Massachusetts General Hospital LGBT Employee Resource Group, a member of the board committee on quality at Fenway Community Health Center, and a member of the AAMC LGBTI Liaison Group. He co-founded and directed the Vanderbilt Program for LGBTQ Health. In 2017, he received the Diversity Champion Award from the Tennessee Hospital Association. In 2018, in recognition of his outstanding research contributions, he received the inaugural Sexual and Gender Minority Research Investigator Award from the Director of the National Institutes of Health. For his work in capturing photographs and supporting the lives of LGBTQ people, Dr. Ehrenfeld was recognized in 2015 with a White House News Photographers Association Award, and in 2016 with an Emmy nomination for his work on the New York Times produced documentary Transgender at War and in Love. Dr. Ehrenfeld is a combat veteran and former U.S. Navy commander who deployed to Afghanistan during both Operation Enduring Freedom and Resolute Support Mission, where he cared for service members wounded in combat. Dr. Ehrenfeld's research, which focuses on understanding how information technology can improve patient safety, outcomes, and health equity, has been funded by the NIH, the Department of Defense, the Robert Wood Johnson Foundation, the Foundation for Anesthesia Education and Research, and the American Medical Association. The unifying theme of his work has been to advance understanding of the science behind how technology can change behavior, reduce variability, and facilitate improved health system reliability and performance. His work has led to the presentation of more than 250 abstracts, as well as the publication of more than 200 peer-reviewed manuscripts. He is editor-in-chief of the Journal of Medical Systems and has co-authored 18 clinical textbooks. He also provides advice and support to the World Health Organization, Digital Health Technical Advisory Group, and an expert in digital health. At the end of Dr. Ehrenfeld's remarks, we will have an opportunity for question and answer. So as you hear some of the wonderful things he has to say, please take note of any questions you have, and we'll have time after, and we'll pass the microphone around. So with that, thank you, Dr. Ehrenfeld, for being with us here today, and the floor is yours.
Thank you for that very, very kind introduction. Everybody do me a favor, stand up. Okay, there's a physiologic reason for this. Sort of do this. All right, now you can sit back down. Because you just had your lunch, and their body, right, sends all the blood to your stomach away from your brain to digest the delicious buffet. And what that does, what that maneuver just did, is it shunted some of that blood back to places that hopefully will allow you to engage in here, what I'm going to share with you. So look at that. There's some slides. Really appreciate that very kind introduction, Dr. Young. I just wish my mother was here to have heard it. That would have been fun. My kids don't care anymore because they've heard it too many times. But really appreciate your leadership in this space and for hosting this important conference and all the work that you do to advance MCW's missions. I wanted to start off by reminding and level setting, as I talk about my work leading the Advancing a Healthier Wisconsin Endowment, by reminding you of MCW's mission, which is fourfold, right? And that's so important. To serve as a distinguished leader and innovator in the education and development of the next generation of physicians, scientists, pharmacists, health professionals, to discover and translate new knowledge in biomedical health and sciences, to provide cutting-edge collaborative care of the highest quality, and to improve the health of the communities we serve. If you want to simplify that, we educate, we study, we provide care, and we improve health in the communities that we work and live in. But wait a minute. Providing care and improving health in our communities, why are those things different? Well, as most of you know, only 10, 20% of our population's health is influenced by the medical care. What I do when I step into an operating room as an anesthesiologist, as a physician, and provide anesthesia. The other 80, 90% is a product of all the things that we know. It's the health-related behaviors, the socioeconomic variables, environmental factors. And it's precisely because those non-medical upstream drivers, contributors to health, are so important to community and population well-being that MCW at an institutional level specifically acknowledges community health as a discipline that's complementary but distinct from individual patient care. Treating the symptoms of asthma, for example, aren't going to get us anywhere if we're continuously returning patients to the living conditions that create and exacerbate the original disease. Too often, environmental factors that drive and cause poor health, both physical and mental, disproportionately affect and impact other marginalized populations. For this reason, MCW's 2025 strategic priorities call on all of us collaboratively as a faculty, as a group of learners, and a larger community to redefine health beyond health care to ensure that all subsets of our community thrive. Addressing the well-known, well-documented, well-identified social determinants of health requires both understanding and trust. Trust born out of authentic engagement with communities that we serve, and a physical presence that creates literal shared space for interaction and collaboration. So I could not be happier that as we sit here having lunch, the final touches are being put on Thrive on King, which is just a stone's throw from here. And Thrive On is a community-focused collaboration between the Greater Milwaukee Foundation, the Medical College of Wisconsin, and Royal Capital, who together envision, we share this vision for a Milwaukee that is equitable, healthy, and thriving for all. And the Advancing a Healthier Wisconsin Endowment, our team looks forward to extending our operations into this truly historic space that's in the heart of our city, along with the Office of Community Engagement and many other local partners. I was hoping we would be there already. My team was down there yesterday. They're still running some wires on the 3rd floor, so we have to wait a little bit longer, but it's not going to be long. Community health also improves when healthcare practitioners look like and share life experiences with the patients they serve. This Saturday, the Advancing a Healthier Wisconsin Endowment and our community partners are going to be hosting the first Black Men in White Coats Youth Summit in the state of Wisconsin at Golden Meyer's Upper Campus. And I would invite all of you, thank you. This has been 2 years in the making, and we are really, really excited. We have over 600 students and their parents registered, 6th grade and up. And I would encourage all of you, if you're available, if you're around, you don't have to come for the whole day, but go to the QR code, sign up, and join us in this unique full-day event designed to provide underrepresented youth with exposure to the medical field. All students, not just boys, 6th grade through post-baccalaureate, parents, educators, healthcare professionals, community leaders, everybody is welcome to this free event. And again, you can find all the information at our website. Now, community engagement has been a key driver of the Advancing a Healthier Wisconsin Endowment's investment strategy since our founding over 20 years ago. And briefly, for those of you who don't know about AHW, we are the largest health philanthropy in the state of Wisconsin. And we're one of the 15th largest health philanthropies nationally. And the only health philanthropy that stewards public dollars. These are public dollars within a private medical school. So we're pretty unique. We were established as the result of a very generous financial gift made by Blue Cross Blue Shield United of Wisconsin to the people of Wisconsin, giving AHW the extraordinary responsibility to steward this financial gift on behalf of everyone living in the state. And we do that by investing in promising biomedical research, supporting community health initiatives, and building the health workforce that so desperately is needed across the state. So since our founding in 2004, AHW has invested, wait for it, over $338 million. That's given away to over 650 specific projects. And our investments have touched all corners of Wisconsin, with direct funding provided to 66 of the 72 counties, and we're going to check all of them off soon, I know. Urban centers, rural communities, self-governed tribal nations. We are committed to maximizing the health of all Wisconsinites. And I want to share with you a few examples of how AHW helps MCW leverage the power of philanthropy to improve the health and well-being of the people of Wisconsin through our investments and our community partnerships. So, an AHW investment in Milwaukee County EMS and community partners, including the American Heart Association, the EMS Council, the Fire Chiefs Association, and Milwaukee area 911 call centers, helped us significantly increase the survival of cardiac arrest patients throughout Milwaukee County. And this project is an example of community engagement at its finest. With funding from HW, the stakeholder group coalition established a system that allows the provision of high-quality CPR instructions to people who call 911. within a targeted service area. Before this project, if you are walking down the street and somebody collapsed in front of you and you called 911 and you didn't know what to do because you never took that CPR class or you forgot, you got hold music, literally, because the dispatchers were not trained to walk people over the phone with what to do. So we fixed that. And as a result of this program, if you call 911 and you're in that situation, you will be given very clear, very explicit instructions on what to do. And because of this, bystander CPR rates, meaning how often does somebody actually initiate CPR when they call, went up from 19% to 52% of the time within Milwaukee County, right? More than double the likelihood that somebody's going to do something while they're waiting for their paramedics to show up. And what's really, really magical about this is the survival rate shot through the roof and doubled from 10% to 19%. That means that lives have been saved, and the system-level changes needed to achieve these results mean it's sustainable, right? The trainings were created, embedded, and now perpetuated across all of Wisconsin. And those system-level changes really are the result of this incredible community-wide effort to put both new practices in place and sustain them beyond the project period funded by AHW. That commitment from wide-ranging project participation has produced measurable population health improvements that continue to today. Okay. Over the course of a decade, La Crosse, Wisconsin, experienced 9 tragic drownings in the Mississippi River near the university. They thought there was a serial killer on the loose. You can see it in the newspapers. La Crosse police contacted the FBI in the State Criminal Investigation Bureau, and they looked at these cases, and they determined that all of those lives lost weren't because of a serial killer. It was alcohol overconsumption. And that realization spurred the formation of a community coalition funded by AHW to change the culture of risky drinking behavior in the city. And recognizing that alcohol misuse was a public health and a safety issue greater than individual decisions and behaviors of a few partygoers, project partners included local schools, the university, the health system, public health agencies, addiction treatment representatives, and they all came together with tavern owners, festival organizers, policymakers, and others to create the system and policy changes necessary to increase the safety of alcohol consumption in the city of La Crosse. A lot of great work came out of this. Among the outcomes of the project were changes in local alcohol licensing policies, education outreach resulting in social host ordinances adopted in 7 of the La Crosse County municipalities, and a resolution in La Crosse recommending specific alcohol safety practices for certain types of license holders. Responsible beverage service trainings were also delivered to more than 200 servers and 450 volunteers for festivals in the area. Bartender licensing fees were established to fund future trainings to be conducted by the La Crosse County City Police Department, making it a sustainable change. Now, one of the 10 communities that participated in AHW's 8-year, $20 million Advancing a Behavioral Health Initiative was the Healthier Community Action Team. This is a multi-sector coalition comprised of a broad and diverse group of community partners in the Lac de Flambeau tribe located in northern Wisconsin. Laying the groundwork for collaboration between MCW's research team and coalition members to work together to address improving the behavioral and mental health within the community was not without challenges. This was really hard work. given the county's long history of marginalization of Native populations, tribal communities are rightfully skeptical of the intentions of external organizations who show up with an offer of assistance. And our collaboration with this team was no different. Overcoming the historical, the generational trauma underlying identity loss and confusion and grief and poor health and vulnerability to substance abuse within the tribal community would not be driven by MCW's research agenda, but rather by reconnecting community members to cultural teachings and traditions and practices that promote healing and strengthen protections against alcohol abuse. Our role, rather, would be to provide the support necessary for project partners to restore that respect, cultural identity, social connectedness, and family ties necessary to thrive. MCW Assistant Professor Brian Jackson was a member of the original community coalition behind the project. And the fact that he has joined MCW as a faculty member after working through a lot of early challenges in this community academic partnership, I think is a testament to AHW's goal of trust-based community engagement. And I thank Dr. Jackson for his commitment to his community, for his willingness to collaborate on a shared goal of health improvement among Wisconsin's Native people, and for sharing his wisdom with and through the Medical College of Wisconsin. So, through these and hundreds, literally hundreds more projects, drawing upon the combined power of academic medicine and community engagement, we have learned how to make the most of our unique resources at the endowment and capabilities. With a culture of continuous improvement, we regularly adapt our grant specifications, our operational processes, to ensure that our academic and community partners achieve the best outcomes, both for themselves and the stakeholders that they serve. So, feedback that we have received from our partners and our own learning over 2 decades now of grant making have led us, along with our governance bodies, to reimagine how do we execute on this commitment to a community academic partnership model for certain types of grants, and to introduce what we think will be important foundational enhancements to the working relationships behind funded community organizations and their MCW project collaborators. Historically, community partners and MCW faculty have had to apply for our seed grants together. Prior to completing an application, community organizations had to identify a faculty member with expertise to join their project, with the community and the partner and the faculty negotiating their respective roles in the project as a part of their application submission. Now, identifying a faculty member, a new academic partner, establishing productive rapport to create a strong project proposal is a known pain point, particularly for smaller community-led projects, particularly if they've never had funding from AHW before. And community partners sometimes struggle to accommodate MCW faculty within their budget to maximize the seed grant allowance. Unfortunately, in rare cases, no suitable faculty members could be found, which was preventing partners from applying in the first place. So we heard that. We saw that. And those challenges have prompted us to enhance our seed grant funding model moving forward, coming up this year with our upcoming RFA that's due out in June. If you're not subscribed to our email, we will fix that for you. As a part of a pilot new approach, which has been heralded by both community and MCW stakeholders. In our new seed grant community partnership model, community organizations will apply for AHW funding on their own and will be matched by our team with a qualified faculty member upon approval of their application. Look at that. we thought this was going to be a big satisfier. Those faculty partners will be drawn from a pool of pre-approved researchers supported by and developed with AHW funding that is separate from the community partners pool of dollars. How about a round of applause for that, too? Yeah. We are really excited by this. And we're also excited by the opportunity to build on our 20-year history of improving health and advancing health equity in Wisconsin in our recently published 5-year plan that started in January of 24 and it goes through 2028. We reaffirmed our commitment to our vision of making Wisconsin the healthiest state in the nation. And we got a ways to go though. We know that, but we're gonna get there together. Our overarching goals include achieving and inspiring positive, sustainable change, translating new knowledge into results-oriented action, and increasing the strength, the agility, and performance of our partner networks. We'll continue to focus on public and community health improvement, health workforce education, and health-focused research, areas where we have a very special and unique capacity to achieve the most healthful future for Wisconsin. So I would invite all of you to download our 5-year plan. It is only 4 pages, to learn about the framework that we have created to deliver on our promise to our partners and frankly to all of you sitting in this room and to the people of Wisconsin. So I want to end by encouraging all of you to support the community engagement donation drive that was mentioned earlier. You know, Dry Hooch has a really special place in my heart, and I think Otis ducked out. I'll have to catch him later. But you know, as a veteran who served in Afghanistan in 2014, 2015, I hold my military veterans and my military brothers and sisters whose service to our country is foundational to the freedoms that we all enjoy, very close to my heart. And I really am appreciative of everything that Otis and his team at Dry Hooch continue to do. They've been wonderful partners. They've received funding from HW over the years. And I'm also such appreciative of the great work that Dan Butter here at the Milwaukee Memorial War Center continue to do, and it's obviously a pleasure to be here in the space. So with that, I think we do have about 10 minutes for questions, which I'm happy to answer, and I really appreciate the opportunity to be here with all of you today.
Thank you. Thank you for great information. Of course, not going through your plan. Is there anything in there that focuses on the homeless population as you talk about a healthier Milwaukee and Wisconsin?
Yeah, you know, it's interesting. So we have a number of champions for ending housing insecurity on our oversight board. And when I got here, I'm relatively new to Wisconsin. I've been here for 5 years. I started to learn about opportunities and challenges in the state. It actually became clear to me that we actually are within reach in Wisconsin of ending homelessness. Right? It is feasible. It is achievable. We have seen some extraordinary work done here in the county in partnership with a lot of folks that's made a dent. And the scale of what we have in Wisconsin, it's very different than what's going on in other parts of the country. When I talk to my counterparts at the California Health Endowment or folks in other parts of the country, the scale is overwhelming of the challenges. It's not here. And so we're planning to tackle that. It's a part of our future efforts, and certainly there'll be more to come.
Oh, I'll bring the mic over there next, but hey, Dr. Ehrenfeld. I once complained into a microphone about the former community academic partnership approach, so I feel like I got to praise this one.
We welcome complaints. That's fine.
No, I think this is amazing. I think this is innovative. I haven't seen a funder do anything like it, so I would love to hear a little bit more about this model. How far along are you? How's it going? And how can we support it? Because I think it's tremendous.
So we have dozens of faculty who want to serve as these partners. And that's great, because we've got a lot of great faculty, and a bunch of them are sitting in this room. And we were talking as a team about how we could launch this. And we said, well, you know, we get a lot of data, because we are constantly asking our applicants, our grantees, you know, about their experiences working with us as a funder, good, bad, ugly. And we get feedback, but look, we're a funder, right? Sometimes, you know, people tell us what we want to hear, and we know that. So we said, okay, we know a lot about our faculty, right? Like we love them, we work with them, we know who they are. How could we really have that community voice help us really identify who the gems are out there that show up, that roll up their sleeves, that are gonna be the ideal folks to serve in this role? So we have community members doing the interviews. And my team just showed me the spreadsheet. And for those of you who love Excel, like, I will send you the spreadsheet. It is magical. It is like, you know, this 50-row grid with all the colors and the things and the times for the interviews and who's doing it and the Zoom link to dial in. It's like, I was like, whoa, who did this? And they told me, I was like, I knew it. So we're doing interviews in May. And our plan is that we will launch this when those seed grants go live in January. But we're really, really excited. We are going to make a few mistakes along the way. That's just the part of doing something new, but we will iterate, and it's going to be beautiful, and I think it's going to be a big improvement going forward. Thanks.
Oh, there you go.
Thank you. Listening to you, you're clearly optimistic visionary. And Ms. Cheryl and I were talking about the spirit of competition that seems to exist in community programming in Milwaukee. In your opinion, optimistically, how do we move from the spirit of competition to the spirit of innovative collaboration so that we can all of us in this room, get the work done together?
Yeah, that's a great question. You know, and in my lens, right, is as a funder, right? And part of it is the structure of what funders can do to reduce that competition. Now, there's always competition. In fact, I'm going to duck out of here in about 5 minutes to go back to MCW so that our oversight body can decide how we're going to award $4.5 million in funding for a bunch of great projects. I mean, it's going to be great conversation because there's good stuff in there. But there's inherent, right, competition, right? They will make a choice about things, and that causes some tension. That being said, when I look at some of the longer-term, more sustained funding approaches that we've used, a $20 million 8-year commitment to communities across the state to then bring us a coalition that could bring together groups that don't necessarily have to compete for the funding because they're in the coalition, that just is a game changer, right? And so figuring out how we can elevate those kinds of approaches in addition to sort of traditional grant making is where we're trying to drive to as a funder. So I will just mention that on June 20th, if anybody here would like to join us in Green Bay, we have rented Lambeau Field for the day, and we are going to have a celebration of 20 years of funding for HW. And now, if you've been funded by us before, you would have gotten an invitation, but everybody is welcome. It is a free event. There is going to be a celebratory dinner. I even think we got a band. And we will be announcing some major strategic investments to the tune of about $50 million in 3 spaces. So come on June 20th and you can find out. And if you can't, dial into our website.
Do you have time for one more?
Yeah, I could take maybe one more.
Okay.
Sure.
Over here.
So I'm curious, you were talking about coalitions that get together and don't fight over the couch change of funding. Is that what I heard correctly?
I'm sorry, is that?
So I heard that correctly. So you're suggesting that the game changer is going to be getting a coalition of people who would ordinarily fight over the funding as a way to expand the capacity to get the funding and then do the mission.
Right. We've seen that be successful in this 8-year experience that we've had. Does it solve every problem? Absolutely not. But I will tell you, and I'm not going to name names, but we have our team's been there in rooms where people who smile at each other but they never pick up the phone are sitting down and talking, right? And that's hard. I mean, we know that, right? And anything that we can do as a funder that can help create that alignment through the structure of how we deliver dollars, we want to pursue. So if folks have other ideas, our team is available. I know Kelly was here early. He ducked back, and I think Kate's over in the corner, who's on our team, Kate Beadle. So let us know. We're always happy to chat with anybody who's got ideas about things that we can adjust. Perfect. With that, I'm going to duck out. Thank you all so much for having me. Appreciate it.
Thank you, Dr. Ehrenfeld, for your wonderful remarks. At this point, we are going to take a few minutes to transition to our afternoon panel. It's called Navigating the Complexities of Community Engagement in All Spaces. We have an amazing panel of people before you today, including our 2 co-facilitators and our 4 panelists. I am not going to do introductions. I will draw your eyes to the screens where you can see our 4 panelists, and I will again thank David Nelson and Tony Whitaker for being prepared to moderate this discussion. We're focusing on the complexities of community engagement in all spaces, and I'm going to let you take it away. Thank you.
Thank you, Sarah. Can you all hear me okay? That's good. Can we do something together real quick? You ready? All right. So we've eaten good, I think, most of us. We have this amazing panel, so we're going to start with celebration. We're also going to start with a greeting. I love this greeting because it means so much. When we talk about community, one of the first things that we do is see each other, right? We see each other with our eyes, for those of us who can. So I want us to say a greeting together. It's called Sawu Bona. So Sawu Bona, and that means I see you in South Africa. So on the count of 3, we're going to say that all together today because we see each other. So on the count of 3, 1, 2, 3. Let me hear it. Sawu Bona. That sounds so good, y'all. Doesn't that sound good? Thank you so much. Can we give it up for our panel early? I celebrate people early. This is what we do. This is what we do. Dr. Nelson, so happy to moderate with you. You know how I feel about you. David. And so we're going to get started. Have your questions ready. Write them down, because the idea is that we want to engage the audience with questions that you might have for this stunning panel that we have up here today. And so I'm going to turn it over to David to get us started, if you don't mind, in terms of asking some very basic questions for all the panel, and then we're going to get into some more questions that centers around their roles, the amazing roles that they have in the community. David, should we do it that way?
Thank you.
Absolutely.
Can you hear me? Is it okay? Got it? Okay, right on. Thank you, Tony, and it's so good to be here, and thank you all for being part of this discussion today, this conversation that we're having. You know, and I just would like to ask each of you, and we'll just go down the line here, to just tell us a little bit about yourself, and just kind of give us a few words and a few thoughts on what authentic partnership means to you. Dr. Laura, can I start with you, please?
Yeah, so bienvenidos a todos. Hoy es una linda día. Hello, everyone, and welcome. Today is a good day. So I'm Kajwa Lor, founding chair and associate professor with the Medical College of Wisconsin School of Pharmacy. I'm a clinical pharmacist, which is different than what you usually think of with a pharmacist. So basically, I'm at a primary care clinic working with underserved Spanish-speaking communities. And some of the work that I've been doing is around building a culture of health, which means that we all deserve to have the optimal health wherever we live, work, play, where we grow, where we age. And some of the work I've been doing is with Hmong refugee communities as well as Spanish-speaking communities. When I think of authentic partnership, I think of myself and my identities. Growing up here in Neenah, Wisconsin, known for Kleenex and man sewer holes. And my first experience is in the refugee community was kindergarten. So I was actually told that I had to take the English as a second language course, even though I spoke perfect English. And I was able, because I actually was in daycare at the time. And so my mom actually told me we went to the school board to see if I didn't need to take the ESL course, but they told me that I had to be in there. So we moved. And that was my first experience here in Wisconsin growing up in an immigrant refugee community. There's authentic partnership for me, I think means having that collaborative trust, really thinking about the community perspective. And I think for myself, as a refugee, like coming from a refugee community as well, how do you have that shared trust and the interest? But then also, I think for myself, as like navigating my own identities as a health equity researcher, it's difficult sometimes. I remember we were on a project and the media came and they didn't look at me. They were looking at my colleague, who is a white male. And I was like, oh, I'm actually the primary investigator. But and so I think that's the perception. Sometimes I feel like I'm in the underdog in many of the spaces that I'm in, from even as a leader to an educator to some of the work that I've been doing around as a chair. There's so many different aspects, and as a researcher. So when I think of authentic partnerships, really showing up with the community, but also building that trust and those everlasting relationships.
Very good. Ms. Harris, it's so good to see you. We see you, and we are honored that you joined us today. Tell us a little bit about who you are and what authentic partnership means to you.
Good afternoon, everyone. So I believe I've lived 10 lives in one lifespan. If I told you I was a professional clown, if I told you I was a model, if I told you I am an opera singer, you would not piece that all together in looking at me. But I am Milwaukee. I am diverse experiences, and I am a part of the voice, and you're a part of the voice of Milwaukee. And so a bit more about me. I span in experience from education, working at R1s, working at every type of educational institute you can possibly think of, even with the elementary school students, as well as government and the nonprofit world. And my really interesting trajectory has led me to understand the impact of research and how that research should be disseminated back to the community and the large void that we can bridge if we so desire to, which will make a substantial impact on everyone's health, not just one population. I think COVID taught us we are inextricably interconnected. Everybody in this room knows that. I see the heads nodding. So if we impact the health of one populace, we can impact everyone's health. And so that's a little bit about me in a nutshell. What I believe authentic engagement is, it's being there in advance. It's building and cultivating that relationship, and not just when you need somebody. I know my name is on several websites, and so I would receive phone calls from faculty members, from people that had interest in doing the best work they possibly could to impact the community. But that's not how we show up to have authentic community-engaged research transpire. We build the relationships, we know each other's name, we see each other in different spaces, and we collaborate. We genuinely collaborate and bring forth what we know is best for the community. So it's authentic, people showing up how they do, the community's voice is engaged, and truly we value the information that comes from our communities because they are the stewards of, and the knowledge, and the holders of knowledge of the community, and they know community best. I think that was a good start.
Yeah. Ms. Key, we see you. Welcome. And tell us a little about who you are and a little bit about authentic partnership, please.
For sure. Thank you, David. And so again, my name is Sydney Key. I will not, bore everyone with the title. I think more so I want to talk about a little bit about the work that I'm doing at Thrive on King and what that opportunity allows me to do as it relates to authentic partnership and engagement. I have the pleasure of working at Thrive on King in the community where we are reimagining the Schuster's Gimbal building as a space for community-driven and community-led investment, as well as lifting up community voice in what they shared our priorities for the redevelopment of this space that has been boarded for minimum of 34 years or so. And so this space that's central to a neighborhood at the heart of a community that has been thriving, has existed for a long time, has deep roots in the city, is a really central location to host and be a convener of engagement opportunities. So I'm really excited about that. And I think for me, authentic partnership really goes back to how we started this conversation with the opportunity and the opening that we led with, and we see you. And so really this authentic piece being that we see you, we hear you, we acknowledge and respect your authenticity and should respond in the same. And so acknowledging that the community's voice is significant, it is a certain level of expertise, and how we choose to engage with the community based on that and respecting and valuing those priorities that the community shares, I think is really a key element of the work that I'm going to be doing at Thrive on King. I really appreciate that you shared engaging not just when you need something, right? So there's a lot of opportunity to find authentic partnership and to say we want to partner and we want to engage along certain issues, but usually when it's led in a certain direction or when it's meeting a certain need or demand. And I think really, to me, what I appreciate about the process that's been lifted up in Thrive on King is that the community was consulted initially to help chart that course and the priorities for the space and the redevelopment. So it really wasn't, let's come in with our magic wand and say, this is the problem that you have, this is how we're gonna solve it, and thank you for being a bystander. This is active participation and collaboration with the community. And to me, that's the most critical, foundational level of authentic partnership.
Thank you.
Thank you.
Dr. Palatnik, we see you, and we're so glad that you're here today. Tell us a little about who you are and what authentic partnership means to you.
Hello, can you hear me?
Nope. I don't think so.
Hello. Awesome. Thank you for inviting me. So my name is Anna Palatnik. I am a maternal-fetal medicine specialist, which is OBGYN that takes care of high-risk pregnancies. I work in the Medical College of Wisconsin, and I've been there as a faculty since 2016, but before that I was a resident here, and I worked in other hospitals as well, within St. Joseph Hospital, Columbia, St. Mary's. And before I came to the US, I actually studied and lived in countries that had free healthcare system. And since coming to MCW, I became interested not just doing clinical work, because it's really hard to improve care, impact care only through clinical work. So I moved doing research. And up until recently, my research was mainly clinical projects, clinical trials, working in the academia. And then another revelation came on that I cannot do it without community partners to truly be successful in that space. And most recently, I'm co-leading a center, maternal health center research of excellence at the Medical College of Wisconsin, where we collaborate with community partners. And what is authentic partnership for me? I agree with many important things that have been said. To add a little bit on that, so addressing the needs of the community partner and not just designing a project that I'm interested without really talking to the community partner, making sure this project can be mutually beneficial, not me only gaining from that, but community also is gaining either skills, funding, expansion, and so on. And I think Jennifer mentioned that being there ahead of time, not just a week before reaching out, but also sustaining that relationship after the project ended, and bringing back the gained knowledge to the community and thanking them, and being there after that. Thank you.
Thank you. Over to you, Ms. Whitaker.
Yeah, thank you, David. So I'm trying to capture all y'all amazing thoughts. And so we met with this panel before, so I'm cheating. I'm cheating, y'all, but I hope y'all taking notes, because we gonna put y'all on the spot in a minute. One of the things that I took away is community is the steward of their own knowledge. Can we say that 12 times, right? They are the experts of their own lived experiences, and involving their voices is non-negotiable. It's non-negotiable. And then relationship building starts before you want to ask for something, right? That's when it becomes authentic, that's when it becomes sustainable, and that's when we start to build trust. And isn't that all what we want, right? We all want to feel like we're valued and not just being used. So that's a beautiful reminder for all of us, honestly. Sydney, you talked about Thrive On, and Thrive On has been a really exemplary example in involving the community. But you raised a really significant question that I thought was so profound because it's an internal question. And I would love to invite you to expound on that a little bit more. And that question was, what did you learn, what did you have to unlearn to understand how to have an impact in the spaces that you're engaged in? Tell us about that journey a little bit.
Thank you, Tony. And I really did appreciate the opportunity to have that pre-meeting among our panelists. I think we brought out some really great points to highlight here with the community. And that's a question that I often kind of keep front of mind in any sphere, in any work capacity, specifically within community engagement. What did you have to unlearn, right? A lot of our process is spent on achieving knowledge, achieving certain levels of certification or certain academic endeavors. So we're always amassing this knowledge, and really, when we have all of that processed in our worldview and our world lens, how we engage with that, I think, is a completely different thing than just what the input was. So really, I had to ask myself, what did you need to unlearn to be successful in this way? And so right at the start of that was, and the community will tell you and keep you honest on it, you don't have the answer, right? So really starting with a little bit of humility and understanding that you don't have the answer is one of those things that helps to keep me honest and understanding that I can't solve these problems on my own. I probably don't even have a good grasp on what the challenge is until I consult community and get input. And so I think really focusing in on what you had to unlearn. So some of those things were really checking your own ego, checking your own bias, checking your lived experience to ask, how is this showing up in how I'm engaging with community? How is this showing up in the decisions that I make, in the way that I design programs, opportunity, space, a lot of those things. And so kind of my journey has been a little bit different. I didn't come immediately to nonprofit work. I worked in real estate for a long time prior to this, and so some of those things were really very evident when you see certain communities that are left out of decision making, and when their needs are not considered. And so really asking the question, what did you need to unlearn to be successful and effective here? Some of those things that really rise to the top are, how do you choose to engage with community? Are you communicating in a way that's receptive to participation and collaboration? And I think really it starts at this self-evaluation piece first, and how then you can bring that forward into all of your work and how you're creating and encouraging impact.
Sydney, I appreciate your honesty about that journey.
Yeah.
To me, that's like humility, right? It takes a great deal of humility, especially when we feel like we're the experts in certain things, to listen to other voices. So we appreciate that reminder. Go ahead.
And acknowledging that community is going to keep you honest about it too. So, expect to hear feedback and expect to understand that while you're the expert in your lane, there's somebody else is the expert in theirs. And so when it's on, topic of people's community, their lived experience, allowing the space to have clear limitations to your expertise, and then hearing from the community and creating that opportunity to really make sure that they're heard is, I think, essential to the work that we're doing at Thrive on King and across engagement sectors.
Absolutely. We all have our blind spots, right? We all have our blind spots. Dr. Lohr, we're going to take it over to you, and David has the question for you now.
Yeah, thank you. Thank you, Tony. I love that Sydney talked about this idea of self-evaluation, and I think we can all have an interpretation of what that means, and it allows us to do so. Kajua, you welcomed us from your own cultural perspective, which I thought was so beautiful and so telling, even though I'm not part of the culture. I really have a two-part question. I'm going to have you speak into the first part, and then we'll go to the second one. But if you could tell us what it means to you to be the community.
It's interesting because I mentor so many wonderful medical students and rising physicians and rising pharmacists. And recently there was a situation basically where a lot of the Asian American students, they come to me for advice or things that they have been a part of. And I've been so blessed to be a part of the projects that they have been on, from invisible identities and the intersections of Hmong and LGBTQ experiences to my current projects that I'm working on around the HAPPY program, which is Health Advancement for Asian American, Native Hawaiian, Pacific Islanders through education, looking at different communities and encouraging us having discussions on health disparities and debunking the model minority myth. And when I have conversations with students, they sometimes say, like, I just feel like no one understands me. And then when they share it with me, we can have a mutual experience or a mutual conversation. And I think it's interesting because my father-in-law recently passed away, and we were talking about interpreters because his chart said needs interpreter. He knows English, actually. He's very educated. There were was kind of like issues around cultural barriers, really, where we took a lot of time to make decisions on getting a transfusion to, you know, getting a peg. And so they were like, is it the cultural aspect or is it needs interpreter? So they found an interpreter for us, but we at the end of the day just needed more time to make decisions. And the student came to me and was like, that happened to me. You know, that happened to my mom. She was Asian American, and we had that safe space, you know, to have that conversation. And I think that's what community means, is that though I may be here and there may be my direct reports that don't look like me, there are still others, right, that look to me for the things that I do, or if I'm going to be serving as a mentor or creating a safe space. Like yesterday, we had an egg roll cooking demo with the Taste of Happiness, which was amazing. The chef was my mother-in-law. And I think those are just things that I realize, like, that's why I'm here. I'm here not for those people that, or the haters that might not like me as a leader, but I'm here for the students. I'm here for the patients. I'm here for ensuring, like, patients understand, you know, the refugee community. And I think because I can dive in between different languages as well, how do you build that trust, right? Even with patients or with community or with students or learners. And I think that's the piece that I feel like community and what it means to me.
Yeah, I'm gonna add on to that. I love that idea of taking time, and so much in American culture we don't take the time because we're always in a hurry to do the next thing. But how is that translated to working with the community? What has been a benefit, and do you have an example of that?
Yeah, so with, for example, one of the projects that I recently worked on was around colorectal cancer. Basically what I noticed was that I actually have family members who have passed away from colorectal cancer, or I know of friends that are Hmong, that they're young and they're getting colorectal cancer. And so I collaborated with some researchers at UW-Madison, actually, and we evaluated one of their databases and found that the Hmong are at higher risk. We actually are diagnosed a decade earlier than the non-white, than white people. And then when we compared, and then also that they're diagnosed at a later stage. And I think that's the piece that I felt like, wow, I can bring that community side of sharing how to create the infographic in the both languages, right? I can be the one to speak about it in Hmong, that cancer, you know, there is no word for cancer in Hmong. It's cancer. So what do? We got to talk about the cells. We got to go back to the pathophysiology. How do you create the language around cancer if there's no word for it? And then now what about prevention, right? And then if your family's diagnosed, one of my family members, they passed away at around 35. Technically, you're supposed to get the colorectal cancer screenings earlier, a decade earlier. So that'd be 25 years old they would start. And the recommendation right now changed to 45 years old. So those are things like people don't know, right? They don't understand, like whether it be the intricacies of the healthcare system or even prevention, in this case of colorectal cancer. But that's been a project that has been really profound in being a part of that piece of the community side.
Thank you. Yeah. Tony?
Dr. Laura, you remind us again that education is power. So anybody in these spaces that can provide that education for our patients and connect with Dr. Laura, what an amazing opportunity that we all have. So Jennifer, you made such a profound statement around bringing things back to the community when we do research. So huge. It would make sense that this would build trust, but expand on that with us. Why is that so important, and what can we actively do to actually bring back the research, the findings, what we plan to do with this that you helped us with? Tell us about why that's important and how that can be done.
So several things flood to my mind. First and foremost would be to ensure that helpful help is at the core of what you do. One of my former mentors, Dr. Hazel, she always grounded me in the thought of, you must find out what helpful help is. Because if I'm just publishing to perish, if I'm writing a paper, if my mom's the only one that reads it, which my mom reads everything, it doesn't help the community. Same with any research that we do. If it's not meaningful to go back to the community, why are we doing it? But in the terms of dissemination, ensuring that dissemination isn't an afterthought. That dissemination is something you plan for, and I've been in the spaces, we know what budgets look like, money is tight, but you find that dissemination isn't often planned for, and what you truly care about is funded. And you see that dissemination efforts are not funded. So truly knowing the audience that you'd like this information shared with and making the meaningful investments in getting that information to them is key, and how the audience will receive it. Everyone isn't going to read a 150-page paper. Everyone's not going to go to a website that you've posted your lovely information on. But if you truly want to get your information out there, it is about meeting the audience where they are and encouraging them forward from where they are so they can truly take in the information.
Can I just say this real quick? So Jennifer, I loved what you said, you fund what you care about. Can I get an amen? So I just need, I need a drink of water. Listen, isn't that such a powerful thing? One takeaway, right? So this panelist is not just here to speak words. They're here to invoke action, and you all are actionable people. You all are in action work. So when you go back to your grants that you're applying for, is dissemination a part of it? What a powerful thing that we can do right now, right? In the future and moving forward. So Jennifer, thank you so much for that. Dr. Nelson, back to you. We have some questions for Dr. Palatnik.
I do, and you know what? Some of the stuff, I can't do it from across the room, and sometimes I feel like I'm across the room, and they say, "You want to sit?" No, I'm going to stand, or at least I'm going to kneel down to be at the same level here. Anna, you work in the area of infant mortality and birth injustice that happens in our community. Can you tell us a little bit about that and this grant that you're working on? And I'm going to have a second question, but I want you to tell us really, because Tony talked about this idea of the grants that you work on, and I know this is a passion for you and for your team. Tell us a little bit about that, please.
Yeah, thank you. You know, every time we say there's high infant mortality, we forget that it starts during pregnancy. It starts with mom. If mom is not healthy, if the pregnancy is not going well, that's going to lead to complications such as preterm birth and infant mortality. So until recently, there's been a lot of funding of the pediatric research, which is very important, but the maternal side has been neglected. So I think NIH realized that, and they funded across the country 10 centers. They called them Maternal Health Research Center of Excellence. That also NIH realized, National Institute of Health, that you cannot just fund basic science projects working in a lab with animals or just clinical trials. They want to fund projects with community partners. They want to fund, they want to address social terms of health and how the social risk factors affect health, maternal health, pregnancy outcomes. And that's the focus of this network of the 10 centers, and we're very proud that we became one of the centers, the Medical College of Wisconsin. We were one of the 10 awarded, I think it's close to $10 million to study that for the next 7 years. We have a big team. Would you like me to go into that project? It's a team effort. And it's not just focused on research. We do have 2 research projects, and none of them is really that clinical. One project, we're working with Jennifer Harris and her organization, looking at and other players in the field of housing instability, how housing instability affects health of a pregnant person, mental health, physical health, and not just homelessness, but all sort of housing instability when someone has to spend a third of their budget on the rent, how that affects their health. And another project that we have, research project, how we can build trust of burning people into clinicians through diversifying the perinatal workforce, working with doulas, with community doulas, and we have an amazing partner, thanks to Dr. Jessica Olson, who's in the audience, who was the one who cultivating this relationship for years, and got me involved, and I became their partner as well. We're looking to see how we can create a collaborative model of clinician doula, improve trust, improve pregnancy outcomes, reduce preterm birth, reduce rates of C-sections. So those are the 2 research projects we have as part of the center. We also have a training piece of that center. We want to train future generation of researchers, clinician, so MD and PhD as well, making sure that at least half of them are from underrepresented individuals in research. And we're going to train, every 2 years, we're going to train 6 candidates to pursue research in the maternal health space through clinical research and community participation-based research. And a third piece of the center, led by Dr. Jessica Olson, and how we can get community partners' input on all steps of this project. So we have this big team, we call it, where we have community partners monthly check-in. We tell them about the projects. They advise us what should be the next step, how it's going to be received by the community. And this is something that's going to continue throughout the 7 years. So this is really a big center, not just focused on research, but we're proud that we're not looking at only clinical factors, but really looking at social determinants of health through this grant.
I love that, and we talked in our meeting about the intentionality of community engagement. I'm going to ask a nuance of the question that I had for you. What would you like to see in the clinical spaces about the intentionality that is needed around engaging the community? What changes would you like to see happen?
So one thing I think I will repeat is doing projects that benefiting the community, going to community and asking their needs, what they want us to, how we can improve the health of their community. The second, specific to the project of the community doulas. We all know there is friction between the healthcare system, the priorities of healthcare system, the time, and fast turnaround of everything. And sometimes patient experience could get lost. And how we can reduce that friction between doulas that come from community space to very medical setting, and nurses, physicians, residents. I would like to see they work better together.
Fantastic. Thank you for that.
Thank you.
Dr. Palagna, you know I admire you, but I'm not going to put you on the spot because she doesn't like that. But I think what I really appreciate about that is that you talked about the strength of collaboration, and that's the theme. That's the theme, the strength of us working together and bringing our minds and our thoughts and our voices in a room and respecting all of that. And shout out to doulas. I mean, I got to admit, I'm one. This is part of my why. Y'all so nice. That is not why I said that, but doulas are partners, not problems. Mm-hmm. And there's studies to show that they make an impact. Yeah. So for all of you who support doulas, who are in this healthcare setting, please remember that. Please support doulas and midwives in this work. It's hard work, and so we appreciate your partnership in that. Are y'all ready to ask some questions?
Maybe.
Well,
I put people on the spot.
While
I'm not
they're
like
thinking,
that.
I wanted to add.
Yes.
So how we start in advance in terms of community engagement, and thank you for your words. Truly, it starts in academia. Again, my lifespan has covered academia, out here in community, all the fun spaces. And one of the things I had the privilege of seeing was aiding my postdoc students through forming larger questions and being ready to engage in research. And then understanding the tenure process and what's valued. Again, you put money behind what you value. And in the tenure process, understanding that faculty members that took on projects that formed around diverse issues, around health disparities, it wasn't really weighed into their tenure process. And so really reshaping how academia values community engagement, engagement around inclusion and belonging, I think that's the first place. And it'll show proof in how people engage with the community and the research that they do.
Yeah, absolutely. Listen, Jennifer, I'm here for it. It's the way that we think, right? It's creating equity. We have to create equity because it's never been created. And that's how we do that, by including everybody in the process as much as we can. So, all right, I'm finna get up. Jess, you got a question? Okay. Dr. Olson, can we give it up for her? Because Dr. Palatnik mentioned, Dr. Olson, yep, I'm doing it, Jess.
I'll do it back, you know I'll do
I
it
know,
back.
but we're not doing that.
I'll do it. I'll do it right now. Or I can ask my question, or I can just love on you. Either way.
Dr. Olson is a prime example of how you connect with partnership. She is humility. She is put my ego to the side. She is a listener. She's an amazing example. We're going to partner with some stuff. You're going to learn more about her. But please, your question, please, Dr. Olson.
I'm going to do it back, but after my question. What I think is so amazing, I have the honor of knowing 3 of our panelists and our 2 moderators, and one of the things that I admire so much, I don't know you, Ms. Sidney, but I look forward to knowing you at Thrive On. Community engagement is so much more than showing up when everything is great and putting on a smile. It's about calling out systemic injustices when we come from a place of power and when we understand when things are inequitable. And I know that you all do that. And so I would love to hear from you how you find the compassionate ways to have difficult conversations when you need to address inequities at a systemic level.
Thank you for that question. Y'all keep clapping, that's fine. Yes. That's fine. Who would like to go first? Sydney, you right.
Right. Now I'm going to jump at once.
Go ahead. I mean, Tony, you can lead it because you have very difficult,
I'm learning.
compassionate
I got my learning hat on today.
So.
I got my learning hat on today.
I could jump in. I think, is it a mountain or a molehill? That's something that I've been thinking about a lot. It just with, when do I speak up and when do I not speak up? Is it worth my mental health as well? Because I think we all have a lot of self-care that we all need to provide for ourselves, our support. I remember when the pandemic hit, and there was a renowned speaker that came to speak about health disparities in Wisconsin with COVID. And the data showed that it impacted mainly Black, African American, Hispanic communities, and Native American communities, and rural communities. and Asian Americans had no impact. Yet, there were families, multi-generational families I knew of that got COVID. I remember there was a rice shortage. I remember trying to get a vaccine for one of my loved ones, and there was no interpreter in Hmong. And it was all in English. How are they supposed to know? And I created this video of how to get the vaccine, because, at the time there were levels and which ones, who are the most important people to get the vaccine first. And some people just wanted the vaccine but didn't understand how to go through the process because it was all in English. And I think that's when, right, we call it out. And the only thing I thought of was I'll create a video in Hmong and I'll post it on my Facebook, and it got so many views. I was just so impressed that I couldn't believe it, that was something that I could do in my house, to help other people. And I think that's when we see those systemic, institutional pieces, that the barriers, right, for people to, in this case, let's say it's obtain the COVID vaccine. But that's something that we can all do, right, to ensure everybody can get the vaccine if they want to. So that's an example.
Thank you, Dr. Laura.
Good one.
Sydney, please.
Yeah. So I'll just share from my perspective, really leaning into my experience in community work. And so kind of my background is just personally rooted in history, and so understanding the historical disenfranchisement strategically of many communities, specifically African American communities, is a lens that I approach work from. And so with that awareness, I have really tried to focus in on creating space to lift up the experts in the community, let them be heard and be present throughout the process. And so not, okay, we've consulted the community and check, right, and then now we're moving on to our process. Really making sure that they have space to be present throughout process, throughout research, program design, all the way through to dissemination. And then how is the end user utility considered in any of the research that we're doing or programs that we intend to offer, really focusing on the end user utility. And I'll give a brief example. So there was I have a pandemic baby, a 2-year-old that we call a two-nager. And so she's 2 going on, her 15th year, and in spirit. So she's this mighty, mighty 2-year-old Zora. And so in 2021, there was an event for focusing in on maternal health. I can't recall the name of the event, but it was essentially maternal health and wellness, specifically in a Black and brown community. And the event was really academically driven and promoted. It did not feel approachable from a civilian lens, from my perspective. And so when I decided that I was going to attend this event, I was like, talk to my sister-in-law. Do you want to come to this? Who wants to come with me? Just wanted to really learn what it was about. This was the first time I was going. And so I went to this event and I said, okay, you know what? It has this academic language, but maybe it's for me, right? Maybe not, but maybe it's for me. So I went, and so all around the room, we get into these great workshops and great sessions, and people are introducing themselves with the institute that they represent or the department, and all of these really great things that they're working on. And so it came to me, and I just said, hi, I'm Sydney, I'm a mom. And I just stopped there, right? I'm Sydney, I'm a mom. And so to me, showing up as my authentic self is one of the ways that I try to model and incorporate addressing inequities in a systemic sense. I think we're great with all of our accolades and education, and all of our experience is significant, but I think really showing up and trying to find ways that we focus in on the end user utility. So some of the challenges and things that I experienced, I tried to attend that event, not in my professional capacity, but just as a civilian. Would I be able to get downtown if I didn't have transportation to come to attend this event in the middle of February on a snow day, right? Would I be able to come if I didn't have childcare with a newborn at home and no co-parent? Right? Are those the questions that we're asking when we consider program design and events? right? I'm fortunate that I did have the opportunity to have help and was able to get there and all of those things, but those were some challenges, and I really felt like for others in the community or other folks that would just really benefit from having these panels and these sessions, it might not have felt approachable. And so really I try to focus in on how can I show up and present those inequities in the space. Thank you.
I'm glad you shared that, Sydney.
Yeah, thanks.
Thank you so much. Anyone else want to answer Dr. Olson's amazing question? Jennifer,
Yes, I definitely
please.
do. So I heard the question hit my ear as how do you compassionately have difficult conversations? So drum roll, conflict.
Yeah.
Straight up conflict. I endorse conflict because conflict is not bad. We characterize it as bad, but conflict means there's one idea here, there's one idea here, and we have the opportunity to invite other ideas so we can create together. So conflict, again, isn't bad, but truly in that moment of conflict, sometimes you have to be strategic. To your point, you have to consider self-care, but sometimes you just have to put it out there. I've been in spaces that if I had not said it, broached the topic, understood who the audience was and how they would best receive it, and data is your best friend.
Yeah.
You cannot argue with a well-plotted, well-put-together analysis that's supported by data. People have their thoughts, opinions, and biases. Let me cut through that. Let me tell you about what's really going on, and then we can move forward. We can collaboratively work and make things happen. So it is conflict, it is self-care, and it truly is being bold and audacious to put it out there, because some things need to be said, some things need to be held. Strategically, we'll say it later, but truly some things need to be said at the appropriate time to make the impact that's needed.
Ooh, Jennifer. Listen, you remind us of a question, what is our comfort costing us? And what is our comfort costing others? More importantly, right? Thank you for that reminder. All good reminders for us, all good reminders for us. Dr. Palatnik, would you like to be the last to share?
Yeah, thank you for this good and difficult question. I will also give an example. So for me, I work in academia, and if I'm passionate about something and I think there's injustice, I'm going to be the squeaky wheel. And I'll give you keep bringing it up. I'll give you an example. So we noticed that there's a condition called preeclampsia. That's when pregnant birthing people get high blood pressure. Sometimes it happens just at the time of delivery. And then during pregnancy, we see pregnant patients very frequently at the end of the pregnancy, weekly. And then once after birth, the patient goes home and may not see her OBGYN for 6 weeks. And especially for those patients that went home with diagnosis of preeclampsia, they used to go home without a blood pressure cuff. And we did not know what happens at home. We had a few events when women had to get readmitted, had high blood pressure. One person even had a stroke. So I started promoting the idea of sending all patients with a free of charge remote blood pressure monitoring system. So every patient goes home with a blood pressure cuff. And there is a way for us to monitor from the hospital. The patient doesn't have to come back with a newborn for a blood pressure check. But that was the practice. If you have preeclampsia diagnosis at 10 days, please come back to the hospital for a blood pressure check. And who wants to do it with a newborn? But if you have a blood pressure cuff at home and you can enter it in the app, in the phone app, and that gets transferred to our call center, I can see it from the hospital. Excellent. I can prescribe medication from the hospital, right? I can prevent that readmission. And it's a cost to the system, to the hospital, to invest in that. You have to have a call center, you have to have nursing staff manning that. Every patient has to get education, the app has to be downloaded, blood pressure cuff has to be fitted, the right size. And many physicians didn't want their patients going home with a blood pressure cuff for various reasons. But I kept really nagging about that, and right now we have a system, finally, in the last year and a half, that every patient that had any hypertensive diagnosis goes home with the system. We monitor remotely. It's a safety net. And I was very passionate about that.
Clap for that.
Dr. Palatnik, thank you for using your resources. This is when we talk about privilege. using your privilege to create equity. Privilege has become this dirty word, and I think that's a prime example of we all have privilege. It's a matter of how do we use it for others. So we got to get away from this idea that privilege is bad. It's good when you use it for good. We're over time. Can we give it up for our panel? Like, oh my goodness. Thank you all for your hard work. Thank you for what you do. We honor you and we appreciate all the gems that you dropped today. Thank you so much. Sarah, we're going to turn it back over to you. Is that what we're doing?
Thank you.
All right.
Thank you. Let's give another round of applause for all of them. And Dr. Zeno Franco, do not sit down because you are up here to wrap up the day. I just want to introduce Zeno Franco. You probably heard his name from Otis of Dry Hooch earlier, but he was off doing other academic things. But Dr. Franco has a great synthesizing mind, and so he is the perfect person to kind of lead us in some reflection and recap of what we did today. So I'll turn it over to him. At the end, we're pulling raffle tickets, and if we forget, please commit to reminding us before you all get up and leave. Thank you.
Thanks a bunch. Thank you, Sarah. So I think one of the things that I've learned is that anytime I'm getting praise, I've left the building. So Otis was evidently saying some very nice things about me. I got several texts and I wasn't even here. But with that, I think, comes a sense of simultaneity. I'm going to say this again. Simultaneity in this work. We're not just doing one thing in one place. This room, these people here, you all are doing stuff across this city, across this county, across this state every day, all day, in multiple locations, with multiple communities, with multiple partners, with multiple families, with multiple individuals who need us to be present with them. Not necessarily to help, but to be present. And so today, while Otis was talking about our work, our shared work in the veteran space, I was at Marquette University going through the dissertation defense process with one of the students who Otis has trained as a community partner in the work that we're doing. So we're collectively, as a partnership, in multiple places at the same time doing the work across the city, okay? And I do regret that I didn't get to hear the praise, but I think there was a reason for that. I'll say, too, that there was lots of great stories today, important stories, stories that guide us, stories that nurture us as individuals. But I'm going to back up to a phrase that I think is very important in this room, in this space, in this city at this time, which is the long arc of justice. I'll show you what the long arc of justice means in practical terms. A few weeks ago, I got an email saying that I had keys downstairs at the security office for the Thrive on King building. Right? We heard today that that building has been shuttered for more than 30 years, that the medical college and other partners are making a generational investment in a location that is designed to serve the African American community, designed to serve the communities around that structure from all different backgrounds. Think about that. An institution is making a decision with partners to rehabilitate a building that has stood vacant for more than 30 years. Right? That's not a small decision. And so a very powerful statement to the faculty and the staff at the medical college where this institution is headed. And when I talk about the medical college, I'm also talking about every institution, every agency. What are the big ticket decisions that we're making that are transformative? Dr. Young talked about a personal journey, returning home with her mom. And a week or two ago, I also talked about a personal journey. I'm not going to go into it here, but a personal journey thinking through the health of my own family after both parents are now passed. And I think one of the things is I would encourage us all to really go back and think through what are our family's journeys in health? And how are we trying to transform the journeys of our children and the future generations as we go forward? In part of that, I think, is a deep recognition, or trying to deepen our recognition even, as people from all different backgrounds, how have we been marginalized? How has racism affected us as families? And that those impacts are generational impacts. They strike at generations in different ways. And I sometimes see young people getting disappointed with the pace of change. I have been at the medical college for 15 years. 15 years ago, these keys were not possible. I'm going to say that one again. 15 years ago, these keys were not possible. It wasn't even an idea that the institution had at that time, right? So for the young people, I would say that arc of justice takes time. And with that, sometimes your elders bear different scars than you have. And how they respond to certain situations is different than your experience. That doesn't mean it's wrong. It means they're trying to deal with, process, understand, accommodate to this world in the best way that they can. And we need to have respect across generations in this work. I'm going to ask this of, so that's my message to the younger folks in the room, and you can define for yourselves where young is. I know where I fall. So, I would say everybody, but I'm going to say to the older folks in the room, again, you define that where you like. Who can still teach you? Who can still teach you? I got an email a few months ago saying that a videographer, an ethnographic videographer that the medical college has worked with for years had passed. Her name is Janet Fitch. She has done some incredible work on gun violence, on partisan stuff in the United States around very difficult and complex topics, using video to have conversations that are inherently designed to depolarize the discussion. When I first started working at the medical college, using video was not a thing as a dissemination tool. When I first proposed that we work with her on some different topics, I was told that $1,000 a minute for video is way too much. It's too much to even conceive of disseminating in that way. How is everybody consuming information right now, right? It's on video, right? I mean, my kids, if they can get a hold of TikTok, they're going to look at TikTok, right? That's the reality, right? So who can still teach you? When I would talk with Janet, right, here's a videographer, completely different than my discipline, trying to figure out how to tell stories that I thought were important, but I didn't know how to tell. She would ask me, what needs to happen? And I would say to her very clearly, well, this, and this needs to happen. And she said, okay. And I would tell her, that's impossible. We can't do that from this institution. And she would just go silent and look at me, right? So, maybe 10 or 15, 20 years older than me. So think about it, she's about 20 years older than me. So here's a woman that's older than me just looking at me in dead silence, supportive silence, but dead silence. And I said, yes, Janet, I get it. Okay, we'll make this happen. But my reaction, even at a progressive, thoughtful institution, and here I'm saying progressive, not in a political sense, progressive in terms of where we're trying to go, that progress is possible toward a healthier state of Wisconsin. My natural reaction, this is impossible to do. What I just said needs to happen is not on the table. And she taught me to push past it, right? And so my question for you here, especially if you're past whatever threshold that is in age, or maybe you're tired in the work, who can still teach you? I didn't think I could be taught anything anymore. I've got a lot of schooling behind me, a lot of years in the field. Janet taught me to the last meeting I had with her, okay? So who can still teach you? We heard from this morning's keynote about the 2030 Health Challenge for Wisconsin, that a more optimized city, county, and state are possible. But we have to challenge ourselves to make that happen. We have to challenge our agencies to make that happen. We have to challenge our governments to make that happen. We have to challenge our funders to make that happen. 2030 is not very far away, right? I've said this in multiple meetings before, and I'll say it again here, which is COVID showed us for a second, it showed us a more just, more optimized city. I'll speak from my own work in the city of Milwaukee, that it was possible to move faster in a more interagency way, with trust, with speed, to serve people that needed to be served. Literally to deliver food to people's houses who were sick, who needed to eat, right? That couldn't come out. We didn't want them going into their workplace and infecting other people. For a second, we saw a range of possibilities to optimize the way this city works. We cannot fail to imagine a better city, county, and state if we're going to hit that goal in 2030. My fourth challenge for you from what we heard today is, how are you telling the story of your work? How are you telling the story of your work in a way that transforms, educates, and changes policies, institutions, and agencies? Each one of you in this room are doing incredible work, but are you allowing that work to truly shine and to be consumable by other people so they understand what you're doing? Not to serve your ego, that's not what I'm saying. I'm saying so that they can see the exemplar of your work and how it is impacting our communities, so they have a better understanding of how to go forward and multiply that work, that we're really educating as we go. And that's one of the themes that came up in some of the group work that happened today, that education should be part of what we're doing on a daily basis in community engagement. Are we really bringing students in, learners in of all types, to understand this work as we move forward? I want to give one other quote. I got a lot of notes here. I could go through them all, but I figure everybody's ready to go home. Just give me 1 second. So my last piece for you is, I think, again, from our keynote speaker, if I remember correctly. She said, iterate to beautiful. Iterate to beautiful. It's not one time. Mistakes will be made. We won't get it all right. But if we iterate collectively, beautiful is possible, right? I want to thank you all for being here today. This has been a wonderful event. Thank you, Dr. Young, for always serving as an incredible host. And thank you all for carrying this work forward. Have a great afternoon.